Okay, good evening, council, staff, and the general public. Welcome to our first council meeting of 2021. I have a motion moved by Lyle Warden, second by Martin Lang. Be resolved that the council meeting of the Township of South Glengarry now be open at 7 p.m. All in favor of the motion? Motion's carried. Thank you. I would ask everyone to please rise for the playing of our national anthem. Thank you, Madam Clerk. If I can have an approval of the agenda. Is any additions to the agenda, Madam Clerk?
Yes, through you, Mr. Mayor. We have several items coming from information only to other business. The first being item 1, review of the water bill layout. Item 2, review of the water survey results. Item 7, Recreation Department monthly update, November and December 2020. Item 14, the bylaw department year-end report. Item 15, the 2020 building permit activity summary. And item 16, the 2020 land use planning activity and comparison.
Okay, thank you. I believe Deputy Mayor Warden, you had one that you wanted to add?
Yes, through you, Mr. Mayor. I'd like to add also the resolution letter of support for small business, item number 6. I don't know if that was called. And also, I'd like to bring a motion forward from this morning's County Council meeting in regards to bylaw or a resolution passed asking the province to open up all small businesses as soon as possible. I'd like to bring that as well, if that's possible.
Okay, so what we'll do, Deputy Mayor Warden, we'll move your resolution from the counties under other business, and then we'll follow under other business in regards to the 7 items removing from the information purposes only, if that's all right with council.
Thank you.
Is there anything else for members of council? Not seeing none, I have a motion moved by Sam McDonnell, second by Stephanie Jaworski. Be resolved that the council of the Township of South Glengarry approve the agenda as amended. All in favor of the motion? Motion's carried. Thank you. He's asking for a new Zoom. Is missing the Zoom link. Sorry about that. One of our delegations didn't have the link to join our meeting, so he should be on shortly. All right. Any declaration of pecuniary interest? Not seeing none. Approval of the minutes of December 21st. Have a motion moved by Sam McDonnell, second by Stephanie Jaworski. Be resolved that the council of the township of South Glengarry, whoops, I already read that one. My apologies. I have a motion moved by Martin Lang, second by Lyle Warden. Be resolved that the minutes of the regular meeting of the council of the township of South Glengarry, including the closed session minutes held on December 21st, be adopted as circulated. All in favor? Councillor McDonnell? You're muted, Councillor.
Mute, Sam.
Oh, sorry. I just wanted to note that I declared a conflict of interest during the closed session, the nature of which was recorded in the closed session minutes. I didn't declare at the beginning of that meeting an open session.
Okay, thank you. Well noted. We will make sure that's in the minutes. And so this motion will be as amended then. So all in favor of that motion? Motion's carried. Thank you. I have a motion moved by Stephanie Jaworski, second by Lyle Warden. Be resolved that the minutes of the public meeting of the council of the township of South Glengarry held on December 21st, 2020 be adopted as circulated. All in favor of the motion? Motion's carried. Okay, we'll move into number 6, presentations and delegations. With us this evening is Dr. Paul from the Eastern Ontario Health Unit in regards to COVID-19 update. Welcome, Dr. Paul.
Thank you. Thank you, Mayor Prévost. May I proceed?
Yes, you may. Thank you.
I'll start with sharing my screen. Good afternoon, good evening, everyone. It's my third or fourth one today. I've lost track of time. I was with SDNG Council this morning, and I just did South Dundas about a half an hour ago. Then I did a media briefing, so it's the same over again. So forgive me if I'm slurring a bit tonight. I didn't drink. Don't worry. I'm just going to give you a bit of an overview. I know that some of you I recognize from this morning on the call, but I wanted to deliberately present to each one of our municipalities in SDNG and Cornwall and Prescott Russell, obviously, because I think that you're getting a lot of questions. You know, this has been a disruption, you know, without precedent, has many effects, economic, social, and so on. And I wanted to have the opportunity to speak to all councillors and mayors and so on. So I'm happy that you're able to accommodate me so I can give you a presentation. I will start with an overview of where we are in Ontario, where we are locally, and then talk a bit about the shutdown, and then ended up with a good news story with a vaccine. So it's going to end up in a good note. So I will share my screen at this point. I'm just going to make sure I've got I always have problems with this screen. I don't know why. Sorry, give me a second here. Just gonna. There we are. I'm just gonna. Why? Are you able to see the numbers here, 638 and all that? Okay, good. Thank you. So I'm just going to very quickly run through them and then focus in on some of our local things. First of all, across the provinces, you know, and across the world, the numbers have been going up. The good news is today we're seeing, hope it's going to be a good trend. The provincial numbers are down to about 2,500 a day in terms of cases, and they had peaked at around an average at around 3,500 for about a week and a half, 2 weeks now. So hopefully we're seeing a bit of a downturn, and I'll show you how that translates into the local level. One of the things that's more striking about you know, the way our cases accumulated is that, you know, initially, even in our EOHU area, we had very little activity, you know, up until around September. Then everything skyrocketed. We entered, you know, August, September with about less than 200 cases. Now we're like 10 times as much. We're 2,200 cases with about 600 active cases. And then if you look at the SDNG area, again, quite low, and then boom, all of a sudden, you know, upwards. And that includes, you know, South Glengarry, where we had 180 cases, including 65 active ones right now. And so you could see sort of how the numbers have gone up. And if you were to look at this map, you know, probably in the middle of the summer, it was more numbers up in Prescott Russell. rather than sort of down here. But you could see right now we've got 180 total cases in South Glengarry, 85 north, and look at Cornwall, 567. And Cornwall, literally up until I would say September, had I think 65 or 70 cases. So you could see how dramatically it went up. And that goes to show you this virus, can come at any time. You should never be complacent about it. And I was telling Cornwall at that time, they were saying, "Oh, we're spared, we're spared." I said, "Yeah, but these viruses, they come out at some point, and so this just gives you a sort of an overview of the numbers that you have there. But I wanted to hone on a few things. Right now, we have 31 hospitalized patients, 6 in the ICU. Of those, more than half are in Cornwall. There's 2 in Winchester. There's none in Alexandria. Alexandria doesn't have the COVID patients at this point. 2 in Hawkesbury. The rest are in Ottawa. We have 6 in the ICU. We have 44 dead, and that includes, sadly, 9 from the home in Lancaster. That is terrible news. And I will talk a bit about that and give you more of an update on that. We have, at this point, again, we have like a sort of daily addition of changes, and you could see that over the weekend, we added 98 cases, and we break it down: 34 in SDNG, 20 in Prescott Russell, and 44 in Cornwall. And again, in Cornwall, we have a large outbreak. We have several large outbreaks. One in Riverview Manor, which has about 18 or 19 cases, and we have another one, a couple of others in some workplaces as well. So they're not all in the community, but that's how we sort of, we see where they're coming from. One of the things that I just wanted to show you as well before I go on to the outbreaks is a rolling average. And this is one of the numbers that we use. It's 7-day case load for the previous 7 days per 100,000 population. And the reason I put that there and we look at it is when we look at, if you recall, the yellow, green, and red zones, and then gray zones. The red zone is anything above 40. Orange, it's really between 25 and 39, and then yellow is between 10 and 29. At one point, we were in the yellow zone, and then we started going up, and you could see what's leading the way is Cornwall with all these big numbers. You could see that SDNG, which is the gray, peaked pretty high. Peaked at 120, 130 up here. And then what we're seeing, even with the Cornwall numbers, we're seeing a kind of a downward twirl, which I'm actually very happy about. I'm not happy about the numbers because we're still in the gray zone. If we were not in shutdown, it would have been locked down anyway with these numbers. But just to show you that I'm seeing a bit of a decrease. So we experienced a sharp increase around sort of the Christmas. I think this is the Christmas rush here. And then we saw on the 26th, we had the first shutdown. We kind of peaked there. And then now we're kind of going down, which I'm hoping that this continues in the right direction moving forward. You could see Cornwall has sort of leveled off, but the numbers in Cornwall are pushed by the numbers in the outbreak that we've had. So that, for me, that's important. The other one I want to talk about is the outbreaks. And right now, we have 16 outbreaks total, the majority of which are in institutions, long-term care, and group homes. There's no good news, but on the brighter side is that the majority of these homes, there's no residents that are positive. It's only one staff because we test them every weekly. Tragically, however, there's 3 homes that have been hit, including the worst one in Lancaster, where today's up-to-date update is 42 out of the 47 residents were positive. There are 20 active remaining, 13 resolved, and tragically 9 dead. And 4 residents are in hospital at this point, at the Cornwall Hospital. 21 staff were positive. Right now, there's 13 active and 8 resolved. And again, you could see that gives you tremendous staffing difficulties. We tested the remaining residents are negative. We just tested them. And some of the staff are pending right now. We've had a lot of support. The Ottawa palliative team was on site. There's a doctor there on site doing rounds every day. EMS goes in and provides hydration or injections or whatever is required. The Red Cross is now in there every day providing feeding and support, PSW type support. Our health unit responsibility is to ensure the infection control and the outbreak measures are taken. And then now the Cornwall Hospital is also in there providing staff on our end and some janitorial to help with the cleanup. And this is a tragedy that repeats itself over and over again. This is the third one we've had in our area, and the 100th one that we've had in Ontario. It's the same story, difficult to contain in the areas. In this institution, there was some individuals that were wanderers, some walking around spreading it, and that's how we saw it in Prescott Russell, and that's how we saw it in Pinecrest. So out of all our deaths, we've had total of 44 deaths in our area. The majority, with the exception of a handful, are in long-term care facilities, and it's tragedy. It's a tragedy. I'm seeing, like I said, a stabilization. There's not much more that could be. At least the ones that remain negative are negative, and we do have now the on-site service, including Red Cross and so on. One of the issues is that, again, when you have 21 of your staff, who are positive, and sometimes you might even have to isolate their contacts. You're paralyzed. You lose your staff. Difficult age group, difficult with certain types of patients, and so on. And I think that at this point, like I said, we have meetings on a daily basis with the LHIN. The LHIN is involved. The doctors are involved. The hospital is involved. We're involved. Like I said, the Red Cross is there. Our EMS help. So hopefully it's getting stabilizing. And we're just going to wait it out right now, and hopefully we won't have any more additional cases. And again, there's 4 hospitalized ones. I'm not sure how they're going to do. A lot of these individuals, as you know, were very, very frail. They were quite had other underlying conditions and so on. So it is just a horrible story. This, like I said, it's the 3rd time over that we're seeing it in our area, and it's really a terrible thing. So we're like I said, going to move forward and support as much as we can, and hopefully we'll it'll end, and it'll go back to some kind of a normalcy. So that's where we are with that home, and so I just wanted to share that with you. I spent a bit more time because I know it's in your area, and I had given an update as well to the mayor over the weekend, before the weekend, and I said I would provide regular updates as well. So it's just, like I said, tragic, and our heart goes up to the families. I hope that the numbers of deaths stop there, but like I said, we've got 4 in the hospital right now that some are not doing very well. So let's see what happens with that. And anyway, that's why you can imagine we're focusing on vaccinating long-term care first. I mean, that's the reason we're doing that. Now, I'm just going to switch my my slides here. I want to give you another presentation, and go to this one. Can you see this one? Is it up? Can you see it? Okay. So this is so now what I'll do is I'll give you a bit of an overview of sort of the provincial numbers, how we compare, and then I'll finish it off with where these infections are coming, and then I'll finish it off with just an overview of the shutdown that we're experiencing right now, and then finish off with a vaccine update for you. This is really our trends going upwards. It's not a surprise. This is our reproductive number. The reproductive number of an infection needs to be less than 1. If it's more than 1, it means one person can infect more than 1 people. So if it's a 1.5, 10 people can infect 15 people, and so on. Last week we were at 1.5. This week we're at 0.98, and it's good because remember I showed you those rolling averages, that those are also the ones that determine what zone you're in terms of level of infection moving forward. And so right now we went from 1.5 to 0.98, which is good. I'll show you another one here. This is just to show you the number of outbreaks we have in our area, and it shows you there's a sort of east-west sort of divide here with nothing in the middle. And that's where what we're seeing. If I were to show you school outbreaks, will be the same, or cases in school, because the higher number of community, the higher you are in that yellow, green, and orange and gray zone, the higher number of outbreaks you're going to have, be it in facilities, be it in schools, be it in workplaces. And that's what we're seeing. This is an indication here for our health unit where you get it, and I'll have a more of a breakdown, a more quantitative breakdown later on. But this light green here really is close contact. So you can see the majority of cases that we get on a daily basis are close contact. These light blue here are outbreaks, and the orange is we don't have a link. We don't know where it came from. It's very low. So this is right now we're seeing that most cases are in the close contact, and I'll show you some more graphics later on that. The other thing is when we measure your level of green or yellow or orange, what zone you're in, we always look at positivity. So test positivity means the percentage of tests that are positive in our area. And you can see that the average in Ontario is 6.8. We are 5.2. We're among the 8 or 10 highest ones. However, this is good news. Last week it was 7.4. So again, those indices are going down. And again, those are one of the things that we look at when we determine what zone one is. And the reason I'm saying the zones is because when the lockdown is over, the shutdown is over, we're going to go back to the zone that we are with our numbers at that time. So that's important for us to know. And the other thing is, this is sort of how we're doing comparatively across the province. And you could see some very high numbers. This is that 7-day rolling average that I talked to you about. And you could see that the numbers are astronomical in Windsor. They're really high up, but we're a top 7. We're right here. But you could see our pink going down, starting to taper here, as is Toronto slightly, as is Peel slightly, and as is Windsor slightly. So perhaps we're seeing now the effect of the first lockdown on Boxing Day, and hopefully we'll get even more effect as we go with the fuller shutdown. So you could see that, we're not the only ones, but we're among the highest in Ontario moving forward. I'd like to be top 10 in the province, but not for this, for other things, better things. In any case, that's where we are comparatively speaking in our area. And you could see that the control is red is right here, way beyond that. This is like gray zone here. This is a very interesting one, and this is a pertinent one, especially when we talk about school kids, because this is what we do. This is the weekly type of positivity, broken down across the province, but by age group. And I'd like to take your attention to the red here and this purple line here. The red one is for 12 and 13-year-olds, and this one here, this purple one, is for 4 to 11. You could see that around the week of 20th here, around here, all of a sudden you get a sharp increase from about 5% to almost 22% here for the red. And so that shows you that school-age kids started going up in positivity. And that reflects that we're getting together and partying and all that stuff during the holidays. And that's one of the reasons, frankly, that schools did not reopen January when they were supposed to. We extended them because we would bring in a lot of kids that were percolating or incubating infections. Same would be with staff as well, with the staff. And once they're in the school and we identify them, then we can stop it. But the problem is we'll have to isolate the whole class, close the class. If the teachers, or staff are involved, they have to stay home. They can't operationalize a school. So you could see that because we had such a high level around us. And by the way, all this was done. There was no school. They didn't get this in school. And that's what we've been seeing with the schools. We've been seeing that kids come in or staff comes in with contacts on the outside. And then we stop them and we stop it. We have mechanisms in place. But if you keep doing that and isolating a classroom or sending 7 or 8 staff at home because they were in contact, then the school doesn't function. So that's the reason. So technically, we're supposed to reevaluate this week the whether or not schools should reopen in our area. But these numbers are the reasons that they did not open earlier. And in Toronto, Peel, York, and Windsor, they're not going to open until February 11th. I have a feeling we might be the same in our area if they continue. If these numbers continue, we're going to have a reevaluation tomorrow with the ministry on that. this is a very important one. This is a slide that I was talking to you about in terms of people, where people get it. Well, how do they get it? So overall, in this is the EOHU, and I'll show you the SDNG ones. This is percentage of cases where they were, how they got them, how they acquired them, acquisition, right? So since August 30th, because before August 30th, we didn't have that many cases. So this shows you that almost 2/3 of cases in our area were basically what's called close contact, okay? About a quarter were healthcare settings, and those are our outbreaks. Those are exclusively our outbreaks. So you could see where most of the community transmission was close contact. If you take this amount here and just break it down, you could clearly see that a bit more than half of the whole pie here is household contacts. But you could see that a quarter of it is close friend or associate going to a person's house, going elsewhere, not wearing masks, not taking the precautions. Another quarter is at workplace. Like not, and I'm not saying we're getting it from clients or public. I'm saying they're doing very well when they're dealing with the public, but then they go to the lunchroom or the lounge, they don't take the precautions and they get infected. Then they go home and they infect the whole family. And we see that time and time again. And that's why we're seeing the numbers go up, because, you know, one case here that's acquired here goes home, and we had families that had 8 people in the home, without, you know, 5, 6, and if you have about 20 or 30 of those, there's your cases. So that's what we're seeing. So people tell me, well, where did they get it? Where did they get it? Well, it doesn't matter where they were. It matters what they were doing, what they were not doing. You know, what they were not doing is they weren't doing the proper precautions. So we do have data on how many people had not taken the precautions. And I want to show you, we've broken it down, and this is the SDNG one, similar pattern, where you have more than 2/3 of the cases, and you could see half of them are household, and then you have these swaths of people congregating outside their household, and then coming back and infecting. So it's the multiplier effect. And this is workplace here as well. So this is the one, this is an interesting graph. This was presented by the minister, by the government, and did some surveys and looked at, you know, behaviors of people. And they estimated that about 1/3 of the population does not follow the public health precautions, but 2/3, which is excellent and we're grateful for, does follow precautions. And for example, they were looking and said, are people in your neighborhood physically distancing? Over 1/3 said occasionally or never, you know, 40% and sometimes, most of the times, and 25% all the time. And then they asked, and they looked, in the last 4 weeks, how many people outside your household visited your home? And, you know, 32% 3 or more said 3 or more, and 28% said 1 or 2 or more, and 50% said none. And among the ones that received people or visited, 1/3 said they don't practice restrictions. You know, and so that's where we got the 1/3. We're also looking at mobility data based on GPS and tracking from mobile and so on, that we're seeing more and more people are more mobile than they were in March. So people are more going out mingling, and that's what's driving it. And they're mingling, going out to a friend's house, going out to eat, meeting a friend, an acquaintance in a park, carpooling, having a smoke or whatever. And that's how they deliver, that they get it. They don't take the precautions and they go home and infect everybody else. But when they're at work and they're with the public, they don't put the public at risk because they're taking all the precautions. It's just among themselves. And that's how it's multiplying in our area. And this is similar across the province. So this is what prompted the second phase, because as you recall, on the 26th, the government put a lockdown, but then extended it into a shutdown with a stay-at-home order, precisely trying to target that 1/3 of the population, and limiting and prohibiting gatherings at home, and limiting outdoor gatherings to less than 5 people. And obviously closing retail and only allowing retail that's essential. Non-essential retail could open, but curbside pickup only, and a whole slew of things. It empowered municipal bylaw, police, and other enforcement officers to be able to ticket individuals. It empowered them to disperse gatherings. And it also give them the right on complaint to be able to file, if you're not staying at home and it's complaint based, but they don't have the right to, if you're walking down the street, say, why are you out here? Why aren't you home? They don't have the right to do so, but if it's a complaint based, they can. We met all of the officers, including your bylaw and officers with police and OPP and so on Friday, just to go over their enforcement powers. So, enforcement is important, but the message really is that you can't enforce it if people are getting together at the back, at home, not physical distancing. It's hard to enforce that, right? So that's why we need to get the messaging out to people when it comes to that. And then finally, I want to end up sort of on a more positive note, that the vaccine is basically in our hands. The Eastern Ontario Health Unit, the good thing, if there's anything about being gray zone, is that we get the vaccine earlier than others. Initially, it was rolled out to Toronto and those hot zones. Ottawa got it as well, and we started getting our first dose of vaccines last week. We are basically starting phase 1. As you know, the vaccines are trickling in, and I'll explain a bit more. They're trickling in. We have a vaccine distribution plan that's with General Hillier and the Premier meet us on a regular basis to go over this. I don't have the dates here because the timelines may vary. However, as a first phase, which we are now, a priority is to vaccinate our long-term care facilities and our high-risk retirement homes. And as of last week, and we receive a shipment once a week. Last week, we received about 1,100 doses. It's one tray of Pfizer, and we were able to vaccinate 3 homes in Prescott Russell, and 2 homes in Cornwall, and 2 homes in SDNG last week. And this week we're going to do 3 other homes in Cornwall and SDNG, and we're going to do Prescott Russell at the same time. What we're doing is, because the mandate's been given to us to go for these homes, as you know, because the numbers I showed you, we're going to go into those homes that have a risk factor. We're going to do long-term Glen Store, Don Lodge, and Lancaster towards the end because they're out in an outbreak. That's the reason. But we should be getting our initial plan was to get everything done by next week, because we were expecting another supply to come in next Monday. However, we were told last night by the General that, as you've heard, Pfizer has held back on some deliveries and manufacturing because they're ramping up. They're doing some retooling of their Belgium plant in Belgium to be able to double their amount over the year to go to 2 billion doses. And so that will give a temporary decrease in the number of vaccines we're getting. So instead of I'm not getting the 1,100 doses that we're supposed to get next week. And I'm skipping a week, so it might push us a week later, but we'll be done by the end of January, early February with all of them, with the numbers we're getting, because they're going to compensate for us. We're going to start getting deliveries again in the first week of February, and then the next 2 weeks we're going to get double each time. So we're going to have enough vaccine for them. We're going to start with the healthcare workers. But the bottleneck right now is the number of vaccine doses that are available in Canada, and you could see the numbers trickle upwards, towards. And this 1.2 million is likely going to occur in February, March sometime, where we'll have completed all the healthcare workers, all the congregate living, and then we're going to go directly into, as we get bigger numbers, doing essential workers, first responders, teachers, and so on, and at the same time doing different age groups and different populations at risk. So all this will likely occur simultaneously, depending on the numbers, as we move into the next phase. I believe that by come spring, I would say April, May, I think it will be earlier, but we'll be able to have vaccine for everybody who wants it. They're adults, because the vaccines are not for kids yet. And we'll run multiple clinics, mass vaccination clinics, as well as at some point when we have enough vaccine, we're going to distribute it to healthcare providers, doctors, pharmacies, and so on. But initially, we're going to be leading those clinics and working with municipalities like your own too, sometimes perhaps requiring an arena or a complex to vaccinate, working, of course, with all the first responders and so on. So we're well into our planning for that. If it wasn't for, I'll be honest with you, if it wasn't for the fact that vaccine is trickling in, we would have had most of this done. I mean, we're ready to go. We've done this before. With H1N1, we vaccinated close to 70,000 people in a week and a half. We did it. We were doing clinics on a daily basis, vaccinating something like 6,000 to 8,000 a day. We're able to do it. So for us, we have the expertise. We have the partnerships with municipalities, partnerships with our enforcement officers, partnerships with everybody. We have vaccinators, we have everything. I need vaccine. So as soon as we get the vaccine, we're going to roll it out. And like I said, if we have to roll it out to multiple populations at the same time, we might say, okay, we'll do this age group here, and I'll need another place in Alexandria or whatever to do the police. We're working with the hospital. So it's all different combinations and permutations. It's just a matter of how many vaccines we have. If I get a whole bunch at the same time, we're going to do multiple groups at the same time, but it'll be difficult for us to say, okay, we'll do first responders and then the elderly at one place. We'll separate them. So we're well on our way with those plans. We've got those plans. We've done it before. We've run mass immunization clinics forever. With our flu clinics, we were doing it yearly for many years. We did H1N1. I was running it when we had H1N1. Same staff that did H1N1 are here. So we have all of the tools to do it. We just need the vaccine. So as soon as it comes out, rest assured that I'm going to be knocking on your doors, giving you updates, and perhaps maybe looking at, like we did with H1N1, if we need to transport people, or all these things. We want to remove all the barriers, like we did with H1N1, and do it quickly. Because the quicker we do it, the quicker we'll get out of all these restrictions. But as a final note is, in the interim though, although the vaccine is there, it's the light at the end of the tunnel, it's a bit farther down. There has to be enough people vaccinated for us to be able to say, okay, now we can remove restrictions and go back to normal. So that's not going to happen for the first 6 months, I'm sure. So in the interim, we need to continue with the public health messaging, masking, physical distancing, and so on. As we then, the more we vaccinate and we see the numbers going down, which I think that'll be the right direction. So that's the good news. The bad news is, like I said, we're still not out of the woods yet, but we still have I see that light as well, even when we look at the numbers, both locally and, as you saw when I showed you on that curve, provincially. So that's my message, and I will be glad to take questions.
Okay, thank you very much, Dr. Paul, for your presentation. I have a quick one before I go to council. I was going to ask this morning, but it slipped my mind as we went towards the end, but okay. I think you might have answered it indirectly. But if you have the virus, and with taking the vaccine now, would that help you with the virus, or is it too late at that point?
No, it would be too late, but it would, but you would still need it, because people say that, well, I got it, I'll be protected. We know that specifically with coronavirus, the coronavirus that stimulates your antibodies doesn't stimulate high enough levels to protect you for a long time. So the vaccine will act as a booster. So it's for future protection.
Right. So I guess I'm going back to the long-term care in Lancaster with the amount of people that still have the virus there. Taking the vaccine today would certainly not help them at this point.
No, it will not help them.
Taking them later would help them.
But we will give it to them later. That's why we're putting it a bit later. We have to wait. Like, we don't want to go in there when they have infection, because we're bringing a lot of staff, and all that. But what we're going to do is, we know that after 10 days, you're no longer infectious. So we'll vaccinate anytime after that until everybody, because don't forget there are different levels. Some people got infected one day and the other. So that's why we're gonna go in, and just because they were infected doesn't mean we're not going to vaccinate them. We're going to vaccinate them again. Yeah,
no, I appreciate that. I just wasn't sure if we vaccinated them now, if it would help them in this situation.
It would not help them at this point.
Right. Okay.
No.
Thank you. Any other questions from members of council? Councillor Jaworski.
Muted.
Thank you. Thank you, through you, Mr. Mayor. Thank you very much, Dr. Paul, for coming to present to us. And thank you for your leadership. I certainly wouldn't want to be in your shoes this past year. So I do want to say, thank you very much for your transparency and your candidness in all the updates. And thank you for the update on the tragic situation at the Lancaster long-term care home. It's really heartbreaking.
It really is.
So I do have I mean, now, and when it comes to that, like, certainly we don't have a role directly in healthcare, but when it comes to our role in providing leadership during the pandemic, promoting and following the messaging about precautions that you talked about, it really helps us to understand the local context, for South Glengarry, and for the residents to be very aware of that very local context. So I believe you said this evening on that note that you would be continuing to give updates to our mayor on the situation. And so I don't look forward to those updates, but I think it's really important information that we have on a regular basis. And I'd suggest if you could incorporate that into the health unit's, standard process of communication with the townships, essentially like this, where it's essentially an emergency situation. I mean, I don't know what else you call it when the Red Cross is brought in. I think it's important that the townships are notified. I mean, I recognize your hands are very full, but I think that information is really important. I do have a question. Now, you did say that the Lancaster long-term care home, they won't be vaccinated because they're an outbreak. However, I mean, I believe, you said it's 42 out of 47. So there are 5 residents who are not currently, they're negative. And I have seen, at least it's been reported in the media, that some homes that are an outbreak, they are vaccinating those residents who are negative, who are still negative. And so I just wanted to bring that up again, because again, my heart breaks for this situation. And there are still 5 people that perhaps, again, I'd like your guidance on that perhaps they could benefit from being vaccinated. So if you
the trick is that,
please.
I'll tell you what the problem is that the home, the way that it's isolated and the way that we've cohorted it makes it difficult to do that. Some of the patients are not mobile, and it's just we're bringing in people during an outbreak, and we're balancing it because we have vaccinated homes that are on outbreak. But I'll give you an example. We did one yesterday or 2 days ago, but no residents were positive. So it was just one staff, and it was very easy to manage. So that's a good point, though. I will discuss it with my staff. There are some, like I said, some logistic things. We can go back, do the rest. It's not a problem. But you're right.
Yeah.
To what benefit it's going to, how's it going to benefit them? That's a good point. I will speak to my staff. But then, like I said, we're not going to be in a position to, yeah, that's a good point. I will take it back to my staff. I'll make sure
Okay.
I have a note here.
Thank you very much.
You're welcome.
Okay, thank you. Councillor Lang.
Thank you, Mr. Mayor. Through you. Thank you, Dr. Paul, for the update. Much appreciated. Most people I'm talking with, and myself included, and we watch the news. The biggest concern people have is the amount of vaccination we're going to get, amount of vaccines we're going to get, and when we're going to get them. And you touched on it a little bit, but could you go a little more detail in our area? Like what we're hearing on the news is that 1 million doses a week starting in April sometime. And so I think to myself, well, 1 million doses a week, there's 36 million people in the country or something around there. Is that going to be 36 weeks? Which is, so from April, we're going to be this time next year before. So, and I'm just kind of wondering if you can kind of give us, your thought on the timelines.
Well, the general seems to think that we're going to get 5 million a month starting in April. That's what the general thinks. Okay. I'm talking about Ontario now. I'm not talking about Canada. Okay. The location. I believe that it's going to be earlier because he bases it on Moderna and Pfizer only. He doesn't calculate Astra or Janssen, which likely will come out in March. So I do believe that we will get those millions a bit earlier. Our area needs a couple 100,000, so, and we'll do it in a sequential way. And I'll be honest with you, if we vaccinate the more vulnerable, one shot, first shot, I wouldn't mind waiting a bit for the rest, because I know that the vulnerable are protected. You know what I mean? So I won't vaccinate the 30-year-olds. I don't, they can get sick, but they won't kill anybody. It's happening. People come home, infect their parent, the parent infects the grandparent dies. We've seen that all the time. So if we're able to protect that chain, I'll be less. But I like you, I'm anxious. But that's why I didn't put the timelines, because the general I put April. I don't agree with him. I think that we're going to get numbers earlier. And he says there's an asterisk at the bottom of that slide that says these numbers are only based on Moderna and Pfizer supply. And we do know that Astra is going to be approved any day now. And we know that Johnson & Johnson, which is another vaccine, which is the one I'm excited about because it's 1 dose. Out of the 4 vaccines that are going to come out in the market, the 3 are 2 dose, but the Johnson one is 1. I'm anxious to see what the studies are, but I heard that they'll be ready to be released in March sometime. So that's going to be a game changer as well, because right now, don't forget, I got to do this twice. You know, you got a first dose, then you got a second dose. One is 21 days apart, and the Moderna one is 28 days apart. Wouldn't it be nice just one shot?
Yes. Okay, thank you. And Deputy Mayor Warden, please.
Through you, Mr. Mayor, Dr. Paul, I want to thank you again for your presentation this evening. For the viewers that are watching, this morning at the county's council, we talked about small businesses and how they're being affected, especially in South Glengarry and throughout the counties in Cornwall. Could you kind of just touch base on that, what you're advocating for? I believe our council, I brought forward a motion to bring that motion from this morning at this table. Could you just kind of touch base for the members and the viewers?
Sure.
Please.
Well, there are a couple, thank you very much. And it'll be my pleasure to do so, although I'm not happy about that situation, as you'll see. So, you know, we're several things. The way that the restrictions apply, they put disadvantage the small retailers. Okay, they allow big box stores to sell everything, yet you know small stores have to sell by curbside only, and it might not be accessible, it might not be convenient, you might not have internet. You know, there's a whole slew of things that puts them at a disadvantage. So that's one thing that needs to be at the level, the playing field. In Quebec, they've restricted those big box stores to groceries and pharmaceutical products only, despite my requesting several times to the government that they didn't do that. The second thing is that unlike big cities and so on, a lot of people, there are a lot of family businesses here that have been devastated by the retail, rural. It's a different type of situation. And not only are they devastated, but the whole economy is devastated. And it's very hard to rebuild in a very rural, you know, not densely populated area. So the bottom line is that we need to support our local retail. We need to support them by perhaps, and the motion this morning was twofold. One was, is there financial aid for them? Because a lot of them we fall through the cracks when it comes to those financial supports. They may own the building or so on. Is that one of the things? And then the other one is maybe we can immediately ask for, you know, level the playing field, allow them to open up, you know, again, for people going in, you know, who can't go to the big box store or who don't want to travel, want to go to their local place, that they can go in and put in a couple of people at a time. I put orders in and procedures in place that all of the retailers have put into place. So I think the motion this morning was really on that, to take immediate action to at least allow the playing field. So you want to buy a pair of pants, you don't have to go to, you know, the big box store. You can do it in your area, and at once you're supporting your retailers. But notwithstanding that, there also needs to be some financial support because of the devastating loss, particularly that's disproportionately affecting rural businesses.
Thank you for that, Dr. Paul. I just thought it deserved some airtime. Thank you, Mr.
No
Mayor.
problem. Thank you.
Okay, thank you. Any other questions or comments? Councillor McDonnell.
Through you, Mr. Mayor, I just want to say thank you to Dr. Paul, and I look forward to getting more updates as far as this goes. I mean, we could sit here all night and discuss it. We appreciate all the work you're doing, and thank you.
Welcome.
Okay, thank you very much, Dr. Paul. I echo my colleagues in regards to all the work that you do. And as Councillor Jaworski said, more reports coming, especially specified to each municipality, would be great, especially in our area with the long-term care facility that we have. We would appreciate an update on those numbers on a regular basis. We know you're extremely busy, and we just want to say thank you for all the work you're doing for Eastern Ontario.
Thank you very much. May I say 30 seconds? Thanks go to our staff. I said it this morning.
Yes.
Our staff, we have a tremendous number of staff that have pivoted, that have changed, we've got people who, or nutritionists who are carrying vaccine, like we're doing everything. So they're ready to go. They've come through. I'm very proud of them, and I acknowledge their help. This is their work. Hundreds of thousands of calls. I mean, we're a small health unit to do 100,000 calls, helping the community and, testing, vaccinating, but they've come through, and I want to thank them.
Yes, and I appreciate that. So on behalf of council, if you can thank them on behalf of us also, we would really appreciate that.
I will. Thank you.
All right, thanks
Bye.
very much. Thank you for your presentation. Before we move on, I wanted to make a comment at the beginning of the meeting, but unfortunately it just slipped my mind for a moment. But after this presentation, I just want the public to know that this council and staff at the municipality are definitely thinking of all the residents and all the families at the long-term care in Lancaster, and to the ones that unfortunately passed away, to their families, our hearts and prayers are with each and every one of you. To let you know that this municipality is certainly working with the long-term care facility as much as we possibly can. We did install a building at the Smithfield Park, which the Red Cross are using, and they're also using our Smithfield building. So I just wanted everyone to know that we are out there. We are certainly, our prayers and thoughts are with everyone, and I just wanted to make sure that council or the public know that council and staff are doing everything we possibly can to help resolve the issue at the long-term care facility in Lancaster. Thank you. So we will move to our next presentation is the Township Facilities Energy Audit Project findings from Wood Environment Infrastructure Solutions. Welcome. If you can introduce yourselves when you come on, please.
Good evening, everyone. This is Iman Nicola here from Wood.
Thank you.
Good evening, everyone. It's Tijo Joseph here, joining from Wood as well.
Perfect. Thank you. We're ready for your presentation.
Great. Thanks. I'll just start sharing my screen here, and I'll ask for confirmation in a sec, please. Can everyone see the PDF file here?
Yes, we can.
Okay. All right. Thank you. Thank you again. Good evening, everyone. And again, my name is Iman Nicola. I'm the discipline lead for the Building Sciences and Energy Management. I've had the opportunity to work with Tijo and the rest of the township staff that were part of this project to look at various facilities in terms of understanding their profile and present some findings that we could pass on to the council this evening for their further consideration. So I'll just dive into sort of a quick agenda here of what we're presenting, just to kind of get everybody on the same page. We're going to look at just sort of discuss the 2008 energy assessment background. The town has completed back in 2008. There was a focus on 5 large township facilities identified as largest energy users of that township. Various energy measures were identified as part of that 2008 report, which was given to us for review. Based on that review, there was areas comprising of electrical findings of efficiencies around variable frequency drives, lighting retrofits, and some mechanical modifications. And this would sort of to help alleviate some of the energy and operating costs throughout these 5 facilities. I'll just pass it on to Tijo here, just to kind of cover the scope of the work that we did, and we'll move into the next slides as well.
Thank you, Eamon. And so just to set the stage as far as what the remit of the current project was, we were tasked with let's say 3 key aspects. One, to quantify the existing energy use within the facilities and to compare that with for a comparative assessment against similar type facilities. The second aspect was identifying various energy efficiency measures based on our site audits, and then the last phase being a financial assessment of recommended measures that could offer energy reduction pathways for the township across these facilities. I also just wanted to touch base on the remit as far as the number of facilities. So we started off with a list of 28 facilities which the township provided. We shortlisted that down to 13 facilities, looking at the existing energy consumption for this across the board, across the 28 facilities. So 13 facilities shortlisted for the scope of work, and a follow-up slide would present that list of sites that were shortlisted. Out of these 13 sites, we narrowed it down to 7 sites that were taken to an ASHRAE, what we refer to as an ASHRAE level 2 audit. which is carving out the baseline energy use by dispersion within these facilities, and last but not least, the financial assessment of all the recommended energy efficiency measures. I'll pass it on to Ayman to proceed with the balance of slide.
Thanks, Tijo. Just to cover the last couple of points here on the agenda that we'll discuss. Kind of share with the wider audience here what the energy use baseline is for those facilities as mentioned, which we'll provide a list to, as well as some of the identified measures and some of the reductions. We'll give you some examples around that. We do have a full report that's been shared that you could potentially, read further on to cover other measures. And then just to kind of recap what the summary of the estimated savings are. So the 13 sites, as Tijo mentioned, were sort of shortlisted of the larger number. The ones you find, and hopefully this comes through clear, the ones that are bolded with the asterisks here are the actual ones that we physically took the efforts to a level 2. But the 13 that are listed here were actually facilities that we were physically visiting. We visited these sites. We took sort of a state of what the envelope conditions were, the operating parameters of the systems for the heating and cooling, the scheduling of the facility, the type of activity that happens within, and just to understand really the use of that facility, to better understand and ascertain how the energy is being consumed. So I'll just switch it over here to Tijo just to discuss a little bit about the summary of the baseline.
So this slide is a snapshot of what we have captured as far as the baseline across the 13 facilities that were shortlisted. We captured based on information provided from the township, the electricity consumption, the cost attributed to those consumption, and as well natural gas being the other utility that's being consumed. Both sets of consumption were aggregated to a common unit, which is gigajoules, and then we established a comparative metric that could be used for a comparative assessment against other similar type facilities. So that metric is what we have here in this table reflecting as EUI. So that's essentially bringing together the electricity use, natural gas use at a facility, combining that to aggregate in a common unit, and then dividing against that the total square footage of the facility. So that way we establish what we refer to as an energy use utilization index, or EUI, in gigajoules per meter square. Now, having established that, we did a comparative assessment against EUI information that's part of broader public sector reporting that's available in the province's open dataset portal. And using that information, we were able to do a comparative assessment against similar type facilities. And the last column here reflects the assessment of that comparative assessment, where we looked at the median value from the BPS data set and compared where the township is for that respective facility type. And that's the snapshot that's being presented here. I'll pass it on to Ayman for the next slide.
Okay. So just to kind of highlight some of the reduction measures that were identified through the walkthrough, some of our calculations that we looked at based on those priority sites that you've seen listed in bold a couple of slides back. Just to capture the sort of the common theme here, and I have to say there's been some very good positive retrofits that's been ongoing since the last study in 2008. For example, the arena with the LED retrofit lighting project that's happened, as well as the IR heaters in the garage facility. But looking at opportunities that are probably under the 5-year payback period, the envelope, just reducing simply the infiltration that's coming into the building, through weather stripping and sealant and so on around doorways and windows and so forth, could really tighten up the envelope of the actual facility and reduce the heating and potentially cooling load that would provide some further comfort in the building. So utilizing that energy within a tighter envelope, obviously there'll be less energy usage there and drive some of that consumption down. There's been through the site visit and pictures and discussions to short measure additional ECMs or energy conservation measures. Installation was an opportunity where some attics and walls and so on were probably could be improved or increased in R value. Very easy to do. It's not very disruptive in terms of blowing in some more insulation into attic spaces to kind of just to contain some of that energy within versus losing it to cooler spots. On the electrical and control side, continue with the LED upgrades, as you can through a programmed transition to implement that. Right off the bat, there was quite a few, I would say, analog or non-smart or non-programmable thermostats that can be easily upgraded, just to kind of sync that up to when the building is being occupied to when the building's not being occupied, just to kind of manage any setbacks and temperature profiles that would be maybe potentially on during off hours. And mechanically, upgrading some of the heating equipment. Some of the facilities do require, I'd say, a refresh of more efficient equipment. They're kind of at their end of their useful life in terms of service. So there's an opportunity there to really take advantage of the potential more higher efficient equipment to be installed. And implementing an HRV or heat recovery ventilator is something very, very low cost, but yet very effective in terms of providing thermal comfort, as well as recovering some of the exhausted heat to preheat the incoming air, just to provide a little bit of that ventilation that's required for some of these buildings under code. So these were just some common ones, but there's been about a minimum of 4 to about 7 or 8 ECMs that were recommended per facility, and they're relatively under a short payback period, very little disruptive or displacement to the building occupants in there. And then just a summary of the estimated savings here for the 6 or 7 facilities here. We've grouped one more, and I'll turn it over to Tijo here just to comment on a couple of things. Yes,
thank you, Emmett. So we have captured a snapshot here of the potential savings, electricity cost savings as well, for the 7 sites which we mentioned. We'd advanced to an ASHRAE level 2 assessment. So that's looking at the energy use dispersion within those sites, and then establishing the measures, and finally trying to establish the 3 aspects. 1, the energy or utility savings from electricity or natural gas consumption perspective. B, the cost savings associated with that. And last but not least, the greenhouse gas reduction that can be achieved against the existing baseline. And based on our assessment, we in looking at just the recommended measures against this 7 priority sites, we have identified close to 230,000 kilowatt hours of electricity savings, and as far as natural gas savings, close to 23,000 meter cube of natural gas savings, and GHG reduction associated with that savings from a baseline is around 67 tons CO2 equivalent. Next slide, Jason.
Right. Thanks, Teja. Just to build on that, if I can just maybe speak to some of these numbers mentioned in terms of savings. So looking at approximately 230,000 kilowatt hours of savings, we're looking at a savings of 20.1% of electricity. When we assess that, and then when we look at that, looking at $55,000 a year of savings, that could be savings toward other capital projects or other retrofits, across other facilities that may have similar conservation measures that would, require upgrades as well. And the natural gas savings of 23,000 equates to just under 35% of the natural gas consumption as a baseline. So these are great savings in terms of environment dollars and money in the council's disposal to potentially continue on the energy reduction roadmap. So just some closing thoughts. Tejo, did you want to mention a couple of things here?
Yeah, sure. So as Ayman was mentioning earlier, in terms of our approach as far as shortlisting this recommended measures, we've focused on ease of implementation, focusing on measures that offer the best value from a payback threshold perspective. We set out to a certain payback threshold level and looked at that in terms of what capital upgrades or retrofits would fill in within that implementation ease as well. In time, as the direction is towards moving, and if the direction is towards achieving, eventually becoming carbon neutral, for example, as various municipalities have set goals around that and moving towards that direction, the carbon intensity associated with natural gas consumption is much high relative to electricity. Now, electricity being much cleaner in the province right now, the grid is much cleaner, so it has a very low carbon dioxide emission factor associated with that. So the deepest reductions can be achieved focusing on natural gas if the intent is around becoming carbon neutral. And so just wanted to point that out in terms of information. Switching from natural gas to cleaner sources of fuel would definitely bring about the deepest reductions from a carbon emission reduction perspective. That would be from my end. Ayman,
yeah, no, that's great. Thanks for sharing that, Tejo. Yeah, so not a very large gas consuming township, but there is initiatives there that could potentially reduce that further down to more of a green operating township. And there's been other considerations built into that in the actual full report, where solar PV has been sort of looked at. We've looked at a particular facility, done some calculations around that, so to kind of give you guys a guideline of what the potential could be, just to maybe offset some of that further consumption. With that, I will open it up to the members on the call. If anyone has any questions, we'd be happy to address any of that. Now, how do I take or accept questions here?
Yeah, that's okay. Thank you.
I'll lead some clarification. Thank you.
Yeah, thank you, Ayman, and thank you, Tejo, for your presentation. I will open it up to members of council. I see our Deputy Mayor Warden has a question. Deputy Mayor, go ahead.
Through you, Mr. Mayor. Thank you, gentlemen, for the presentation. One of the grids caught my eye, and I'm just wondering if there's an error in the data. The Lancaster treatment plant shows that it consumed 83,401 kilowatt hours, and then we paid $57,000 in hydro, and then the Charlottenburg Arena used 482,160 kilowatts, which is quite a bit more, and the percentage of the cost seems to be off. Is your number off on the kilowatt hours for the treatment plant? Just something doesn't seem to be right there.
That's a fair point.
Do you see what I mean? How the numbers are like, even compared to Glen Walter, the water treatment plant uses the other, they
The rate-
uses.
Yeah, no, fair point. So the rates are different in terms of, so the Lancaster treatment plant, I think, was around 0.69 cents per kilowatt hour is when you divide simply the two numbers. And the Char Lane Community Center, I think, is what you're referring to. I think it was getting around the 17 cents per kilowatt hour. So consumption values and costs were provided to us from the township. We are still waiting some affirmation on the cost and data just to kind of confirm that, but this is data that we do have right now and summarized, in this table. So we receive monthly data, monthly costs, and we've just amalgamated it and used that as sort of a baseline 2019 year to get a representative consumption, energy consumption and dollar spend, just to get a behavior here.
Okay, thank you. Thank you
Okay,
for your
thank you. Sorry, Deputy Warden, thank you. I'll go to Councillor Jaworski, and then we have a question from Councillor McDonnell.
Thank you, through you, Mr. Mayor. Thank you very much, gentlemen, for your report. I have a question, but I think it's probably more towards our staff. When it comes to the Charland Recreation Center, there's in the report, it suggests about changing to or upgrade to LED lighting. And I was under the impression, certainly, at least on the ice surface, I thought that those they're not the old lights. I mean, I don't know exactly what's in the new box fixture, but I had assumed they were LED. So is this upgrade to LED, is that perhaps for the non-ice surface part of the building? I'm just surprised it would be that much to upgrade.
Right, yeah. So in terms of the upgrading the interior lighting to LED in the Char Lane Community Center / Arena, currently the majority are manually operated and they are of T8 fixtures of 32 watts. Now, with the exception of, the LED fixtures that are in place in the arena, main area, meeting room, and men's washroom in the building. So there's still a larger area that could be retrofitted from the T8 to LED. So I think the process has started. It's just a matter of now getting to those other square footage areas where the T8s are. Okay. So sorry, the lights that are on the arena, like on the ice, those are LED or those are T8? Those are LED. Okay. All right. Thank you. You're welcome.
Gentlemen, just a quick question. This is a draft audit project findings, I guess. So what are the next steps from here? Are you going back to make any changes, or is this coming back as wouldn't be another delegation, but I guess as a staff report to council? Is that where we're going? I don't know if you can answer that, or if Mr. McDonald or Mr. Robertson can answer that question.
Through you, Mr. Mayor, I can answer that. The report is in draft form. It is a fairly comprehensive report. You've just got the executive summary as the presentation. So we'd like to leave this with council for their review, and we do have some validation to do, as Yamin said, with some of the numbers. And once we have completed that, and if there's any questions from council, we can incorporate those into the follow-up with the consultant. The plan would be to not represent the study, but to bring it back to probably a future meeting, maybe the second meeting in February, to receive and adopt as the energy efficiency plan that would be then blended in with our asset management plan, and those capital projects would be taken under consideration as part of our program moving forward for capital and energy efficiency.
Okay, thank you, Mr. McDonald. Deputy Mayor, I'm sorry, Councillor McDonnell.
My question's been answered. Thank you, Mr. Mayor.
Okay, thank you, Councillor Jaworski, and then Councillor Lang.
Thank you, Mr. Mayor. Sorry for the additional question. One thing that had been discussed during budget was about changing the heating in the arena from like the overhead radiance to more like seating heating, I guess more radiating up. And I was wondering if that was something that the gentleman doing the audit, if that was something that they looked at or considered or have an opinion on. For the seating area,
Yes,
predominantly is what I'm referring to.
yes, I can hopefully provide some comment to that. Yeah, so the overhead heating versus the slab heating. In terms of retrofitting that, there may be a larger cost just to do with, getting into the slab area versus, potentially pouring a new slab or concrete area and then running your PEX tube with the boiler system, to provide that in-floor hydronic heating. So, I mean, we haven't looked at, the detailed costing around that. If it is an interest, we can definitely take that further in terms of coming back. But yeah, I don't know, Tijo, any comment to that or?
Yeah, nothing to add from my end. I think I've covered that.
Okay. I mean, if it is something that we're still considering, I think it'd be good to get their expert opinion on.
We actually, I think hydronic heating in floor ideally works best on new construction, where you're setting up the infrastructure, or if you have the ability, for example, like garage spaces where you have a nice slab where you can kind of build up another inch of concrete pour on top of that, where you can lay your tubing PEX down and secure them down, and then pour on top of that to create a big sort of thermal mass. So it's just really looking at, I guess, how the slab heating profile is situated, any of that sort of additional retrofit that may cause disruption to seating itself. But we can look at that closely and specifically and comment on that in the final report.
Okay, thank you. Before I go back to members of council, I think Chief Robertson may have a comment towards that issue, so I'll let him deal with that first.
Sure. Thank you, through you, Mr. Mayor. We are, myself and staff are evaluating the heating issue that was brought before council for budget 2021. This application and with our consultants, it will be a good discussion because the type of seating that we have in the Charlotte Arena setting may be something where a hydronic radiant system may work more so than with individual seating in some other facilities, as they are bench style and built right off a concrete slab. So these are things that we're looking at in-house, and we will be reaching out to our expert consultants for their opinion. So thank you.
Okay, thank you. Councillor Lang.
Thank you, Mr. Mayor, through you. Before I ask my questions and make my comments, just to add on to that, we definitely should be looking at it for the new township garage and the retrofit of the Williamstown Fire Hall, because we're going to be in construction and it would be easy to do for those ones. So if we had an idea of the number of years of payback for the extra expense of putting those systems in, would be helpful to make that decision. Anyway, on to my a few points I had in reading the report. Number one, the Glen Walter Fire Hall, and this just maybe it's just a typo. It's down as 1,200 square feet. I'm quite sure the Glen Walter Fire Hall is 3 or 4 times that big. So just a typo in the report. A question in further on in the report, when they go to the ECMs, most of the buildings are being recommended to change the lights to LED. And most of the buildings say it's 3 to approximately 4 years payback, except for the 2 water treatment plants. And both of those plants are saying that it's a 1.2 and a 1.1 year payback to change to LED lighting. I'm just wondering why it would be so much faster payback in those 2 plants, if there's something different about them, or if that's just an error. And I wonder if there was, I think that's it for now.
Thank you for your question. So with respect to the payback period, when it comes to the LEDs, yes, there is some facilities are a little further out. It's to do with the number of lighting, A. the operating hours of that facility. So I believe some of these plants, they're basically turning over 24/7. The treatment plants, they're operating. They're not a 9 to 5, so lighting is potentially on for a lot longer. So that's where the additional savings are realized.
Can I follow up to that? I
Yeah,
thought
go
it would be the opposite, because in reading the reports of those plants, it said that the only staff is only in there when monitoring or testing. And I just don't know why we would have to have the lights on most of the time. I would think the lights could be off in those plants most of the time if there's no staff in them. And
Right.
maybe that would be a place to put in the, motion sensor, so it could be on just when they're there, but I wouldn't think the staff would be in those plants very much.
Agree. And I've been to several water treatment plants, across the GTA and the Kleinburg area, and what I've noticed through my site visits is you get a gentleman here coming in and to look at a particular sort of operation or just check on things, and he switches the lights on and then walks out, and the lights have been left on for the next sort of 8 hours or so. But we are assuming a 24/7 hour operation, so we can definitely add the motion with the LED potentially as a retrofit and really reduce the savings there. So that's where we've taken into account some of the upgrading to LED, where there's been some incorporation of the motion sensors, which reduces a further 10% more on that.
Thank you.
Okay, thank you. I believe Deputy Mayor Warden, you had another comment or question?
Through Mr. Mayor, no, it was pretty well in regards to a follow-up comment to what Councillor Jaworski said. It just seemed that the auditors weren't familiar with what we passed in our capital budget for the arena heating. So, and then Chief Robertson said that he'd be in contact with them. That was all.
Okay, thank you. Is there any other comments or questions? Councillor Lang.
Just a comment, and I think it's more for us that we should take a closer look at our procurement policy and make sure that it must be cheaper to put these things in during construction. Like not all the lights in the Glen Welter Fire Hall are LED, which seems kind of silly. We only built it, what, 3 years ago, maybe. We maybe need to look at that. Instead of changing out lights and throwing them out now to put LEDs in, we should have put them in at first. So I think we better look at our procurement policy and make sure we get that in there ahead of time.
Okay, thank you. Deputy Mayor Warden.
I'm getting used to 2 screens. My mouse was on the other one. My apologies. I want to second that thought from Councillor Lang. I think this is, we have a committee of the whole at the county level. I think this is a discussion that needs to be had on its own meeting. I think, a holistic view of how we approach projects and how we should into the future. I think this whole audit is a perfect segue to that, and I don't know if there's support for a roundtable discussion on this stuff, but Councillor Lang hit the nail right on the head.
Okay, thank you. I agree with you. I think a separate meeting, I guess, just in regards to this, once we get it back, once we have a full report, I guess would be the time to do that, and then we can decide in regards to where we are going to go with that in the future. Any other questions or comments from members of council? Not seeing that. Question to either Mr. MacDonald or Mr. Robertson in regards to having council digest this, I guess, and go through it over the next little while. At one point, do we have till get it back to the presenters here this evening to make any changes if we have any that we would like changed? Is there a date for this, or is it just ongoing until we're satisfied with it?
Well, through you, Mr. Mayor, we don't have a deadline date. I think it's more important that this document is something that the council is comfortable with. So if it does require more time for review, that is certainly something we can accommodate. At the end of the day, we want to get it right. So for now, I would suggest that if we do want to target to have the final report done by the second meeting in February, we would pretty much need to have comments from council by the 1st or say the 10th of February at the latest.
Okay, I'm comfortable with the 1st of February. I mean, it's 2 weeks away, so I think we could probably have an opportunity to go through the report within the 2-week period. If there's any comments, we send them to you, Mr. McDonald, or to Mr. Robertson, or?
They can come through me at this point. I've been the lead on the project at this time, but do acknowledge that both Lachlan and Chief Robertson have been very much involved as well. But the comments can come through me, and we'll work collectively with our consultant to make any changes or bring forward questions.
Okay, thank you. Deputy Mayor Warden.
Through you, Mr. Mayor. Should we be having this discussion before we finalize and adopt this plan as what Councillor Lang spoke about? Is that something we should be doing before it comes back to council, or do we pass it and then have the discussion? And Mr. McDonald, I had a very hard time hearing you. I think Councillor Jaworski did as well. She had her hand up to her ear. If you could, thank you. I don't know.
Okay, thank you. I have no issues in meeting prior to the 1st of February if we need to get any changes that we want to make in by then. I'm sure Karen can set out some dates tomorrow to see what's available in respect over the next 2 weeks for either an afternoon or an evening. And then we can go decide in regards to what date we want to pick. And then we can talk about that and then send back our thoughts or our comments at that time to Mr. McDonald, and he can send it back to the presenters for this evening. Are there any other questions or comments? Okay, not hearing none. So thank you very much, gentlemen, for your presentation this evening. We will be meeting as a council in regards to this issue. Any information will go back to Mr. McDonald, and he'll forward it to you two gentlemen in the future. And if there's any changes we require, we'll ask you to make those changes and come back with another.
Thank you. Thank you. Have a great evening.
Thank
All
you.
right, thank you. You too.
Cheers. Good night.
Right. Okay, we'll move to new business, staff reports, 2021 interim taxation bylaw. Mr. Lachlan McDonald,
Thank you, Mr. Mayor. Can everybody hear me all right?
correct?
Oh, it's very rare that people hear me more than they hear Yoan. He has a much better presentation voice than mine, so this is an honor. So 2021 interim tax bylaw, typical at this time of year. My competitive nature wants me to have it be staff report number 1, 2021 every year, and the clerks have so far obliged me. It just allows us to tax before our final tax due date is, or our final taxes are set. We're presently waiting for education rates and county rates, so we couldn't set a proper rate anyway. This allows us to collect on March 31st and May 31st, and it's generally considered a housekeeping item on the administration side.
Okay, thank you, Mr. McDonald. Any comments or questions? Not seeing none. I have a motion moved by Sam McDonnell, second by Martin Lang. Be resolved that staff report 01-2021 be received, and that bylaw 01-2021 being a bylaw authorizing the levying of interim taxes be read a first, second, third time, passed, signed, and sealed in open council this 18th day of January 2021. All in favor of the motion? Motion's carried. Thank you. And number 2 is the 2021 borrowing bylaw. Mr. McDonald.
Thank you, Mr. Mayor. Another housekeeping item that we do typically at the start of the year. We haven't had to ever borrow money from the bank, but in the event of a cash flow requirement, this allows us to borrow $3 million from our bank presently. That number remains unchanged. Point number 7 says there's 2 alternatives at $3 million or a lower maximum. That was mentioned 2 years ago as an item. I just kept it on there in case somebody wanted to lower it. It doesn't hurt to have $3 million in the event we need it. So I'm recommending $3 million. That's what we have done the past few years.
Okay, thank you. It's something we do on an annual basis. Pretty self-explanatory. Any comments or questions? Not seeing none. I have a motion moved by Lyle Warden, second by Stephanie Jaworski. Be resolved that staff report 02-2021 be received, and that bylaw 02-2021 being a bylaw to establish borrowing to an upset limit of $3 million in 2021 be read a first, second, third time, passed, signed, and sealed in open council this 18th day of January 2021. All in favor of the motion? Motion's carried. Thank you. Thank you, Mr. McDonald. And number 3 is the eScribe meeting management software. I don't know who that is. Is that you, Madam Clerk?
Thank you, through you, Mr. Mayor. So as the report states, I am requesting a new agenda and meeting management software on behalf of the Clerk's Department. This is software that the county is also pursuing. Having spoken with colleagues throughout Ontario, really, this is a well-regarded company, a Canadian company, and most clerks I've spoken to, if they don't have it, they sort of wish they had it. So the software we've been using, I've mentioned struggles with it this year in my role here. And again, even this week, just trying to upload a simple report can take an hour when it should just be a few clicks. So we're hoping that council would support the township modernizing and adopting this new software.
Okay, thank you. Any Councillor Jaworski?
I fully support this. I understand, that's what South Stormont does, and that it allows, like, when they, with their live stream of their council meeting after the fact, they are able to synchronize the agenda with the video, and so you can go back to the agenda and go directly to that location of the live stream of where that particular part of the agenda was addressed. So, I mean, yeah, there's lots of pluses, but I mean, certainly that's one to highlight, just because, now with the way we're doing things, I think it's great to continue that and to use one of those upgrades that's available through eScribe. And it's, I mean, in the end, it is fairly cost affordable, it's cost effective. Thank you.
I just should add, I think the functionality that you've mentioned, that is sort of a larger package than we're going for at this point, but it's certainly something we could provide more details to council on if it's something you're interested in. What we're looking at now is sort of one of the lower baseline packages, but that is something that was explained to us. I can't recall the exact amount for the YouTube plugin, but it might have been an additional $1,000 or $2,000. I'd have to confirm.
Well, certainly, I would support getting more information about that, because I think it's a very handy tool.
I think we could get the ball rolling with what's before you, and I can bring that forward and add on to it as needed.
Okay, any other comments or questions? I guess my comment to the clerk, Councillor Jaworski, was I was wondering if we were going to approve this evening or defer and wait for more information, but you want to go ahead and... Okay, thank you. I have a motion moved by Martin Lang, second by Sam McDonnell. Be resolved that staff report 03-2020 be received and the township of the South Glengarry authorizes the mayor and clerk to enter into a subscription agreement for supply of meeting management software with eScribe. You heard the motion. All in favor of the motion? Motion's carried. Thank you. Madam Clerk, should it be 03-2021? Is that? Yes. Okay, I'll just make that change on here. Thank you. Number 4 is the drinking water quality management standard endorsement. Mr. Sege, I believe, is here. Mr. Sege, go ahead.
I am. So good evening, Mr. Mayor and Council. Tonight, I am bringing back the operational plan manual from the Drinking Water Quality Management System, also known as DWQMS. I brought it to your attention on December 21st, 2020, that we are looking to bring version 8. We're moving from version 7, just a few minor changes that I hope everyone had time to review, and we are looking for endorsement this evening, and I can follow up with any questions if any are needed.
Okay, thank you, Mr. Sege. I'll open any questions or comments to members of council. Councillor Jaworski.
I just wanted to thank Mr. Sege and all his work in getting the final document completed. There was, just a few minor changes really from the last one, and I did look through it thoroughly, including the comments that have been made in the past, just to double check that everything was incorporated. Yeah, it's very well done. Thank you.
Thank you. Well said, Councillor Jaworski. Any other questions or comments? Not seeing none. I have a motion moved by Lyle Warden, second by Sam McDonnell. Be resolved that staff report 04-2021 be received and that the council of the township of South Glengarry receive the Drinking Water Quality Management System Operation Plan Manual, B8, dated December the 10th, 2020, that the mayor and council reaffirm their commitment to the operation plan, and furthermore, that the mayor and clerk and operation authority representatives be authorized to sign and endorse the document. No other comments or questions? All in favor of that motion? Thank you. My motion's passed. Thank you very much, Mr. Segi, for your presentation again this evening. And number 5, goal 3.1, initiative organizational review, Mr. Mills.
Thank you very much, Mr. Mayor. Good evening, council, members of the public and staff. Tonight, I'm going to bring you a review of the organization. As an introduction to this, I've been the CAO now for 14 months. Time flies. I've had an opportunity to see many of our everything in action over our seasons: winter, summer, spring, and fall. And also with the pandemic and the office being closed to the general public, it hasn't necessarily been business as usual, which has also given me more time to look into operations. I'll refer first to our corporate strategic plan with goal 3. Goal 3 was to strengthen the effectiveness and efficiency of the organization. And specifically tonight, I'm going to talk to you about the organizational review and recommendations from the CAO and senior staff. Just to start it off, just referring to our vision, we're a unique community and we're committed to an innovative future. And innovation is key here. Our values: accountability, innovation, excellence, trust, and respect. And I want to highlight a few things in terms of our mission. We're committed to excellence. You'll see throughout the report, it's fiscally responsible. And Dr. Paul talked this evening about how it's been devastating to a lot of people in our communities, particularly businesses. And we were mindful as senior staff when we put this together. And the overall with the reorganization is to improve our services for our community and our residents. I mentioned the strategic goals, and number 3 there, strengthening the effectiveness and efficiency of our organization is what we're going to focus on here. As a background, there have been a few municipalities recently in the South Dundas and South Stormont that have completed organizational reviews and that use consultants. Anywhere, bringing a consultant in can run anywhere from $30,000 to $70,000. So that's an initial savings there if we were to have done that. And with council's wishes, having neutrality, maintaining the draft budget's decrease and the net levy. And of note, it's the first time since 1999 that we've done that as a municipality to reduce taxes. So with senior staff, we reviewed the organizational chart to determine if redeploying people would create a more efficient corporation. In consultation with Treasurer McDonald, we worked very closely and worked with CARE not to increase the budget line in 2021 as a result of recommendations for restructuring. Council was updated on December 7th and 18th in closed session about some of the thoughts. So this isn't necessarily new here for council, but it was done in closed to respect the fact that there are some impact specifically to individuals and staff who are aware of the fact that I'm coming with this tonight. So the outcomes of the reorganization, a list of 4 additional positions, which I will talk to shortly. Accounts receivable clerk and finance, a GIS planning technician, a deputy clerk, and a deputy treasurer in finance as well. The outcomes of the reorganization, the review, the disbursement of economic development duties will go out or come out of the CAO office with the clerk and the deputy clerk and the GIS planning technician. It will result in increased savings, increased capacity, and we're working in a team approach. The second point there, in terms of reviewing overtime requirements, that it was determined there was a lot of overtime that we were paying for the AR clerk, accounts receivable, but also transferring over to the AP clerk. So a second clerk was found to be a priority. And the increased reporting burden and provincial emphasis. Treasurer McDonald has a big year ahead of him with asset management reports that are going to have to be completed by mid-year. And there's a realignment there to create the deputy treasurer position. The AR clerk, you see the duties there. I'm not going to read them all, but we'll report to the treasurer and general manager of finance and the deputy treasurer. And you see a list of things that's important in terms of, collecting arrears and taxes, for example, providing backup for our services, decreasing the risk of fraud. Those are all important things that they can bring to the table for us. The GIS planning technician will support the planning, building, and bylaw department and report to the general manager of planning, building, and bylaw. They can support the whole organization with GIS and goal 3.3. Cross-training of staff is extremely important. Enhance our customer service and create a GIS interface for the township. And also support economic development initiatives and administrative support for the general manager. The deputy clerk will report to the clerk, strengthen cross-training, and be responsible for communications along with the clerk, support economic development, and provide backup. There's a general theme throughout the presentation about providing backup, and besides the fact that in any normal year, which this has not been, you would want to have backup in key positions. That's one of the things that was a focus here. During COVID times, it became even more evident that you need backup in key positions. And we really need to improve our records management, look at digitization of records and our filing. I've mentioned the deputy treasurer earlier, who will report to the general manager of finance and the treasurer. Cross-training comes across through all of the departments. It needs to be enhanced. We need to have staff that can perform multiple roles, and the asset management plan I've touched on earlier, support consistent collection of tax arrears, and I'll allow for better management and leadership opportunities. So the further outcomes of the reorganization. The GM of Community Service would be renamed GM of Planning, Building, and Bylaw. And Economic Development, as I noted, will come out of the CAO's office. The GM of Corporate Services will rename Treasurer and GM of Finance. The Director of Water, Wastewater, and Acting Director of Roads and Waste Management would report directly to the CAO. And each director assumed key function as responsibilities that are presently being performed by the GM of Infrastructure. And the Manager of Roads position is absorbed into the Acting Director of Roads and Waste Management. Lastly, the clerk will be a renamed Director of Corporate Services clerk and assume supervision of the deputy clerk, executive assistant, and reception. The HR advisor will report directly to the CAO as well. So with the additions, there also are subtractions. So the communications coordinator will be consolidated in the clerk's office with the deputy treasurer, the deputy clerk and the clerk. The economic development and tourism coordinator will fall under the CAO's office and be eliminated as a position, and as will the general manager of infrastructure. You'll note in the staff report that there were also additional savings in overtime and finance, with seasonal and casual staff benefits, and some impending retirements where we can not replace. So with the financial analysis, just of note, salary and benefits there. So that's not just salary, it's salary and benefits if the numbers look high. We've done the low range and the high range in terms of the additional costs. And then the financial analysis of the subtraction of costs in the low and the high range. So just of note there, you see the reduction in overtime. The recreation lead hand who will be retiring in the fall, and that we have a number of staff in the past that were full-time in recreation and facilities. They're now seasonal and casual, and there's a saving in benefits, along with the number of positions that I've mentioned earlier that we're going to subtract in terms of costs. So the overall, you'll see on the next slide, in terms of financial analysis, there's always a concern when you do a restructuring and a reorganization that you're going to actually add cost to the organization. In this case, the low range to the high range is $35,000 to $48,000 in savings, not to mention some other things I'll talk about shortly about how this is going to improve the organization. It aligns extremely well with the strategic plan that I've mentioned. I've highlighted throughout about cross-training. We have to have a nimble staff who can perform many functions, and that's the goal in a small municipality. And what I found over time in my 14 months here. And we need to explore opportunities to make the delivery of customer service even better. It's going to be a busy year. Looking ahead to 2021, I've listed some things there, some key studies and audits that we have: the road study, route optimization, security audit. You just heard energy efficiency. One of the difficulties when you get all this information or these studies is to take that information and make things better and execute. And with the reorganization into teams with more oversight and backup, it'll allow us to execute better. There are also some key things like office renovations, the roads garage and the fire hall, the asset management plan. There are a number of things. One I just thought of was the Glen Walter Master Servicing Plan. The list goes on. So we have a lot of work ahead of us. On the right-hand side, on the clerical side with identifying service excellence, we need to improve as an organization on how we review policies and our bylaws. There's a definite upgrade required, and that's in the budget with the phone system. Digitization of records and records management. eScribe was presented tonight, and eSignature is another one. E-commerce for payments, and there was a report just before Christmas about cloud permit in the building department with virtual. As I get to the end here, there are some further considerations. COVID-19, you see in the business world where how many people are working remotely now, how companies have to be more nimble and do things differently. First of all, the reorganization allows us to look at wellness for our staff, and also backup for our staff. That it was discovered here that if someone wasn't able to come into work, we all have families, other responsibilities, that where was the backup? In many cases, there wasn't backup there. And then putting added stress and strain on the staff member who was trying to look after their personal things. And we were calling them at home on holidays, or, you know, even if they were off work ill because we had no backup. So that's one thing. The other is in terms of service and technology. You'll see a theme that's gone through there about technological advances, that we want as many people in the municipality as possible, if they don't have to come into the office to get service. Certainly we want them to come in if they want to, but many people work long hours. They can't get here in the morning, they work long hours at night, and if they can, we can service over the phone or through technology or online. So that's been an eye-opener. The second one there is collaboration. As CAOs in the lower tiers, we've talked about collaborating on service, working together. For example, economic development, tourism, IT, communications, roads and training, and that's where I've added the counties there. Over 40% of tax dollars within our municipality goes towards the counties. So we need to, as lower tier CAOs, not only to work together, but look towards maybe how we can get more service and or work together with the counties and other tiers. I noted at the beginning about our mission, commitment to excellence. This is definitely a fiscally responsible report, and we were mindful of that given how hard we worked as managers and staff to come in with a budget that we did for 2021. It wouldn't make sense to do that and then come before you 2 weeks later and say, by the way, we want to add all this to the municipality. I just want to finish with one last thought about constraints. As leaders in the organization, as a CEO and with senior staff, certainly maybe even council in on this, it's important for us and our teams to embrace constraints. We don't know what's ahead here. Certainly there's been a lot infused by the province and the federal government, but we know that that's not going to continue. But now we have an opportunity with a restructure and a reorganization to embrace those constraints and to move forward. And actually, when you embrace constraints and look at the constraints that we're faced with, we tend to get more creative and innovative with things. So there's some creativity and innovation in the reorganization of staff. There's been a lot of thought go into it. And the last thing I want to do is thank the managers and all of our staff for the hard work they've put in. We're already 10 months into this pandemic. Dr. Paul led off the meeting talking about how difficult it is, but we see light at the end of the tunnel. And I just, as a leader of the operational side, want to thank all of the staff and what they've done to support us as managers, but also you as council on behalf of constituents. So with that, I'll take questions. Thank you.
Thank you, Mr. Mills, for your presentation. It's, I think, a well thought out presentation in regards to the restructuring of our employees here at the Township office. So thank you for that. I'll go to Deputy Mayor Warden, if you would, please.
Through you, Mr. Mayor. Tim, I just wanted to thank you for this report. It was laid out really well. And I'm looking forward to seeing the implementation of it. Thank you.
Okay, thank you. Councillor McDonnell, then Councillor Dworsky.
Through you, Mr. Mayor. Mr. Mills, I really wanted to say thanks too. What I like most about this report is, contrary to a lot of the reports we do get or consultant work we would have normally done on this, the 35,000 we'd save on the low end the first year would be lost right away to the cost of the report and then some normally. So that was the big thing I wanted to highlight on this. We're going to save money at the end of the year, and it's not going to be all lost to a consulting firm. It was done in-house, and it was very well done. Thank you.
Thank you.
Okay, thank you. Councillor Jaworski.
Thank you, through you, Mr. Mayor. Similar to what's been said already, CEO Mills, I do really appreciate what you've done here. I appreciate that you've done it in-house, not just because of the cost savings, but also it shows, strong confidence and takes accountability really for the decisions that are being made here. Certainly in my work life outside of this, we often see consultants being brought in to make decisions that then people can say, well, the consultant said we should do it. But so I give you kudos for, doing this, taking the accountability for this. And I do think it's ambitious. You are flattening part of the organization, but I think that is, that's a good thing. And that's how you've achieved a lot of the cost savings in that. So I think again, it's a good thing to see employees being given more responsibility as they're able. So, and lastly, it's been said, but thank you so much for making this a cost savings exercise for the township, now more so than ever. And I think, what you've presented here in terms of how this is going to make us a more nimble organization and better to serve the public, I think that's really the end goal. So thank you very much.
Thank you.
I couldn't hear you, Mr. Mayor, but I'm assuming you're
Yeah.
acknowledging my hand.
Go ahead. Thank you.
Thank you very much, and through you. I'll repeat what everybody else said. Thank you very much. Good report. And just to keep it brief, and thanks for listening to us in closed session the last couple of times, and the ideas that we had, and incorporating them into this. And I think it's a win for everybody. Thanks.
Okay, thank you. Any other questions or comments? Not seeing none. I have a motion moved by Stephanie Jaworski, second by Martin Lang. Be resolved that staff report 05-2021 be received, and that the council of the corporation of the township of South Glengarry direct administration to proceed with the organizational realignment as outlined. Any further questions or comments? Not seeing none. All in favor of the motion? Motion's carried. Thank you, Mr. Mills, for your presentation and the great work for that. And we look forward to seeing the changes in the near future.
Thank you.
Okay, number 6, the Charland Recreation Center operations. Chief Robertson.
Thank you, Mr. Mayor. Good evening, all. Tonight, I'm going to speak about some considerations we're making for the Charland Recreation Center regards to operations. I'll go over some of the dates, but most of them were everybody's well aware of, and many of the details were shared by Dr. Paul this evening. But on December 26th, we entered a province-wide shutdown, which resulted in our public buildings being closed, access to our public buildings being closed. As a result of that shutdown, we made the difficult decision that because we weren't serving the public in our usual recreation programming, that we made some staffing changes, resulting in 4 casual staff being laid off. Subsequent to December and January, the province announced a stay-at-home order for 28 days, commencing January 14th and running through February 11th. So with the indoor programming at the Recreation Center being closed for 47 straight days, if it ends on February the 11th, we've examined the financial and operational implications in addition to any decisions and how they might affect our user groups. And the decision will be that we're considering is whether or not to keep the ice surface in or not. So just in the analysis, we're currently staffed in the recreation department with 4.5 full-time employees, and without the regular programming, they are preparing for the summer recreation programming that we usually do. We're actively working in our facilities to get them ready, and doing some other projects that we're able to because of the time that we're allowed right now. So in coming to the decision, but in coming to the analysis, we did reach out to our 3 main user groups at the Recreation Center, those being minor hockey, the skating club, and the Charland Rebels Junior B Hockey Club. Our conversations with those groups really entailed what everyone's expectations were of life that we can assume after February 11th, when this current stay-at-home order is lifted, and basically how that would affect our operations. So I think we do have to assume that some operational restrictions will continue to affect all user groups after that date. I don't think any of us, let alone Dr. Paul, has a crystal ball, but we do know that the odds on us going from a complete stay-at-home order and a lockdown, shutdown, to fully being open to our user groups would be slim, but that doesn't mean that some of our user groups wouldn't be able to operate as they see fit within those guidelines. So the main crux of this report is whether or not we keep the ice surface in. So if we were to cease winter operations of the refrigeration plant and thus the ice surface, our numbers, our evaluation of the financials with our treasurer, the operational savings will approximately equal any lost revenues. We still have costs for staffing and for facilities and all those types of things. We're just allocating them into different areas in the municipality at this time, but those costs don't go away. If we were to close down at some date between now and the end of the season, if we were to close early, we would see some revenue losses for ice rentals and facility rentals in the Tartan Hall, but those would be equalized very closely with our operational savings. Savings to ice maintenance, to the cost to operate the machinery to keep ice in, the electricity for plant and lighting, and the staffing savings. So with that, basically, we're approaching council tonight to have a discussion, and we're also recommending to council that we, as administration, have the authority to cease winter operations as related to the ice surface, and that the ice be removed from the arena pending consideration of realistic return to play. So we're not saying that we're looking to necessarily shut it down tomorrow, but we would like the authority to, because it will affect our user groups, but we would like the authority to, when it doesn't look like we'll have any realistic chance for regular return to play is the term that I'm using as for all our user groups, that we have the option that we can shut the ice plant down. So with that, I'll open it for questions. It's not something that we can really have any firm information because we don't know what the future may bring. But with that, I think we can all make some basic assumptions and have the discussion. So I turn it over to questions.
Okay, thank you, Chief Robertson. I'll go to open questions. Councillor McDonnell, then Councillor Jaworski.
Through you, Mr. Mayor. Thanks, Mr. Chief Robertson. Be honest, at this point, after listening to Dr. Paul this evening, if we weren't in a province-wide shutdown, we'd be locked down anyways. At this point, we're a little bit better than Toronto, and that's not saying much more. I mean, we're what, 5.2 and they're 10, I think it was. We're about halfway. We're way beyond where we should be. At this point, if they lifted the shutdown, kids aren't going back to school in South Glengarry anyways. So I don't see the cases drastically dropping in the matter of 2 weeks or 3 weeks. I don't see them letting them play hockey or skate. So I'm of the position right now. If we don't see a complete drastic change by the end of the week, you might as well shut the plant off.
Yes, sorry. Okay, sorry, go ahead.
Oh, that was basically at this point. If we don't see a drastic change by the end of the week, I'd say shut the plant off. For all intents and purposes, looking at the numbers now, you can pretty well shut it off now, I think.
Well, I personally would like to hear back from the Minor Hockey Association to know exactly what their thoughts are in respect of, are they coming back to the ice or not? My understanding is I think the Rebels are pretty much done at this point in time, but I don't know where minor hockey is. But anyway, we can get back to that at some other point, Chief Robertson.
Just quickly, to build on that exact point, we definitely, like we did prior, it is very important to us that we do consult and discuss this major change to our user groups season, because we do understand how it affects both them and all our users. But so we will have those conversations to finalize sort of any direction. They are also both their local associations and the larger associations, be they minor hockey or skating or leagues. Those discussions are being had in many, many places now. This may be, the writing may be on the wall, or sorry, we may be informed by other sources what our answer needs to be. So we will have those conversations.
Councillor McDonnell, then Councillor Dorsky.
Through you, Mr. Mayor, just I'm basing it off at this point what we're hearing from public health and from the Eastern Ontario Health Unit. At this point, they're going to let them go back to school, let alone sit in the dressing room and put skates on in the next, 2 weeks. So by February 11th to this rate, I don't see our numbers coming down enough. And I just look at it as a business case. Day by day, we're losing more money. So do we want to lose $46,000 for the opportunity to maybe get back on the ice? As much as I'd like to see kids skating, I'm not very optimistic.
No, I think we agree with you. I just think that we're going to know more tomorrow, I guess, from the province in respect of if the kids are going back to school or not. So maybe we can make decisions as every day, I guess, from this point on. But I just hate to take out the ice and minor hockey asks us to return. So that's the concern. If minor hockey doesn't want to return, then I'm more comfortable in respect of removing the ice. But I'd just rather wait to hear from them, and we can put out a request to hear from them actually in regards to what their thoughts are. But Councillor Jaworski and then Councillor Lang.
Thank you, through you, Mr. Mayor. So, I think, like what CEO Mills said earlier, is that we've had a lot of constraints on us, but it's also pushed us to be creative. So I want to keep that perspective if we can. There are things that have cost us more during COVID, and I think that this is a good example of where we should be able and be willing to have increased expenses, again, to provide a very valuable service to our residents, including, both physical and from a mental health perspective. And, certainly there would be some savings in getting in closing down the ice plant now. I mean, we are still employing all those staff. So, it really comes back to the plant itself. So the costs are perhaps not as large, because some of those costs we're spending anyways. But, I very much want the community to be able to use the ice surface if and when it's possible. And my understanding from the skating club and minor hockey is that if they are able, they want to return to the ice. And in both cases, they've suggested that they would even be willing to, look at extending their season to using the ice, in March and in April. And, from an outdoor temperature perspective, April is actually colder than October. So it's not inconceivable to have ice at that time. So again, in terms of being creative, I know we've never done it before, but, is there an option of turning off the plant now and then turning it back on, or redoing the ice when that time comes to allow them to be able to use it? I don't know if that's possible, but certainly if my opinion is, if the communities can use it for 2 months, I think we should do what we can to make sure that that is possible. I know we don't have a crystal ball and it's not looking good at this stage, but I certainly want us to do everything we can. And if the expenses go up for this, it's something that I still would support, because I think there's a lot of value to having the rink running.
Hey, thank you. Councillor Lang, then Deputy Mayor Warden.
Thank you, Mr. Mayor, through you. I'd like to see the rink open. I'd like to see the kids there, but I'm not sure they're going to be there. The part that's troubling me is every time the province puts in one of these, lockdowns or any of the measures that have been put in, they put a date on it, and that date is almost always extended, you know? Look at the US border closure. We've been extending it a month at a time now for pretty near a year. You know, it just, these things, I mean, hopefully things will turn around, but our numbers are a lot worse now than they were in the spring. I just don't see it turning around too fast. But I have no problem supporting this motion tonight, because this motion isn't saying that we're going to pull the ice out tomorrow. This motion is giving the staff the ability to look at the groups and to you know, instead of waiting for the next council meeting, you know, if something comes up in between and says that, you know, we're not going to be opening, then they have that ability. And I'm just looking at the savings of $40,260 is 1.5 months. If we pulled it out today, we could have almost 2.5 months. So there's, you know, there's $50,000+. We got to think about this. Are we going to spend $50-some thousand of taxpayers' money for the slight chance that a few kids could get back and skate in March? I don't know, maybe we need to be pulling the ice out and find out what it costs, because I know we have an outside firm comes in to shut down the compressors and to restart them. What would it cost us to shut it down right now and then put it back on, turn it back on, and, you know, take a week or two to get the ice back up and running when the time does come, if it does come? You know, if that cost is reasonable, you know, let's shut it down for 3 weeks or whatever the time is, and then you can make that decision later. And if it doesn't come back, well, then we're ahead of the game. And if it does come back, we spend some money and open it up and run it for the, you know, last half of March and all of April or something. Just some thoughts. But I would support giving staff the ability to make that decision between council meetings. I would appreciate it if they were going to make that decision, though, that they let us know and give us a heads up. That's where I stand on it. Thanks.
Okay, thank you. Chief Robertson, how long would it take in the temperatures that we have outdoors today to have the ice removed?
Well, I'll start by saying I have discussed a lot of these options with our staff. They are the subject matter experts. Other than working on an outdoor rink, I haven't done a lot of specific flooding in the recreation center myself. So, but their comments are that, one, we just don't know. We haven't done it like this in the past. Our sort of historical, well, every year since the 70s when the facility was built, in essence, around that, you know, late March date, we shut off the refrigeration plant, we open the doors, and we let the warm weather outside melt the ice to a degree that we can actually remove it. And you know, there's certain things that we have to do. We have to protect the concrete surface. We have to remove the cost of the vinyl lines and the painting, and the ice surface is actually we use the whitener to actually make whiter ice than natural ice. So all those items would be, we're not quite sure what'll happen. The timing of year is an issue. In essence, if we open the doors, especially in the next 2 weeks, we're not going to be getting warmer ice. We're going to be probably getting colder ice. If we leave the doors shut with the plant off, we're assuming that the heat in the building and the adjoining recreation center will actually slowly, much slower, than in the springtime. It will slowly melt the ice. In speaking with staff, we're not worried about it taking a long time to thaw, because the water will actually remain in that area and drain out the one end through the existing drain. So to say that we can take the ice out, we don't know how long that would take. Because we don't want to mechanically go in there and really take the ice out because of damaging the concrete and the boards. So we don't know how long it would take for the ice to leave. If we were to leave the ice in as it is with the compressors and the refrigeration plant off, staff are advising they don't trust that we would have good quality ice and maybe safe ice, because it would, they're using the word shale ice, so it would be layered. We're not positive about that, but that's our assumption. They're saying that, and I firmly believe their opinion is that the best ice would be created right off of concrete. So if we were to take the ice right out and then restart the plant, we would have, I'm going to assume, probably $2,000 to $3,000 extra of cost to bring our outside contractor in to shut off the plant and to restart it. In essence, that would be double the price of our standard operations in a year like this. So, you know, to touch on Councillor Lang's comments, if we were to turn it off sooner than later and see what type of ice we have in that magical date in mid to late February when we're allowed to actually go back to operations, we can try that. Or we may be able to take the 10 days to rebuild our artificial ice right from scratch on asphalt. So, or sorry, concrete. So I'm not offering a lot of concrete answers, but it's something for council to consider. So.
Okay, thank you, Mr. Chief. I'm just not sure if I'm comfortable in respect of removing it now and putting it back in a few weeks' time, but Deputy Mayor Warden, if you would please.
Through you, final comments, I guess. I'm not optimistic that the rink is going to be able to be used. It was throttled, we throttled up to the state of emergency, and it will be throttled down over a period of time to back to the orange level. And as Dr. Paul said, today we are in fact in a red zone ourselves. So if the province wasn't shut down, we would be with the numbers. I say pull the plug, and I understand that's disappointing maybe to some residents, but I think we need to be mindful that we want to get this pandemic over and done with. And I think if we allow staff to make that decision, if sooner than later, I think, and we shut it down for the season and focus on a fall startup, and hopefully the vaccines will be done and we'll back to our normal lives. But I'm not confident that we are going to be in an environment where our residents are going to be allowed to use it till the ice is supposed to come out. So my thoughts.
Thank you. Mr. Chief, did you have your hand up?
Yes, through you, Mr. Mayor. Just one final comment. We have an additional meeting tomorrow amongst the 7 municipalities and SDNG in the city of Cornwall for the recreation group. There is some conversation about, there are facilities that do stay open all summer within that area. We do have some that are able to stay open longer in the season because they're constructed, they're better insulated to do that. There's also been some discussions about if we look at this as a whole with all the users, do we have some arenas in regular years? Do we have some arenas open earlier, and those groups who want to begin play earlier operate out of those other facilities? And maybe we have South Glengarry in the future start early and end early, those types of things. So we can have those discussions. I mean, our user groups want to play in our own home rink. We have the best user groups and we have the best facility, but there are other options. If it does come to that, there are other options for some of those user groups locally to continue if and when the emergency orders are lifted to a point where regular recreation programming can continue. So.
Okay, thank you. I'm going to go to one more question, but maybe, Mr. Chief, we can get some more information after you meet with the other municipalities tomorrow. Maybe you can bring more information back on February 1st. And if you can get some type of something out of the Minor Hockey Association, that would be great to hear also before February 1st to hear what their thoughts are. I'm going to go back to Councillor McDonnell, if you would, please.
Just a comment through you, Mr. Mayor. I guess if we are going to pull the plug and shut down the rink, I know I've had emails from a few user groups that were particularly the skating club, with some people that are anticipating on maybe competing later on, or maybe later past when we would normally have ice. Maybe if for some miraculous reasons we are lifted right out of this lockdown and we're back into a yellow or an orange in the next month, and we've taken the ice out, we do decide not to put it back in, if we're delaying putting it back in because of the wait time, maybe we just be prepared to maybe refer some of those people to whether it's the Benson Center in Cornwall, where they maybe have where they have ice year round. And maybe if we are taking this away too, we just remind people that there are other things you can do for your mental health. If you need some exercise, get outside, Summerstown trails, things like that. So just maybe something for our social media people.
Okay, thank you. Last question or comment, Councillor Jaworski?
Thank you, through you, Mr. Mayor. Just quickly, I was encouraged by Councillor Lang's, approach that, again, maybe we do have options and being creative, again, like that, having that creative approach. And I'm hoping, Chief Robertson, when you talk with the other arena users tomorrow, that you guys, that there can be some brainstorming about what other some of these creative approaches that we can have. I mean, again, it hasn't been done before about shutting the ice off and then rebuilding, without scraping it down to concrete, but maybe someone else has done it and maybe they could give a definitive answer on oh no, it's not really that bad. You just have to, keep certain things in mind before doing it. So again, I just want to strongly support that we do what we can to provide the ice when our residents are able to use it. And to keep in mind that these two organizations have expressed interest in going in on March and April, if that's possible.
Okay, thank you. So we'll wait to hear back from Chief Robertson in regards to more information after he meets with the other municipalities and from Minor Hockey Association, and then we can make decisions at that point. And hopefully the province, we hear from them in regards to where, if we're staying in a lockdown or we're coming out of that, and what the next options are from there. So I do have a motion on the table, moved by Sam McDonnell, second by Lyle Warden. Be resolved that staff report 06-2021 be received, and that the Council of the Corporation of the Township of Glengarry gives administration the operational authority to cease winter programming activities related to the arena, and that the ice plant be turned off and the ice removed from the arena for the remainder of the 2020-21 season, pending consideration of a realistic return to play. Just kind of confused a little bit maybe with this motion. Is it pending consideration? Is it who's going to make the decision, or is it going to come back to council before we make that decision? Or are we giving you that authority to do so? Chief Robertson.
Administration's request is that council authorizes administration to actually make that decision when we have the information, the proper information to make that decision. So, and
not putting our trust in administration by all means, but could we defer this maybe until we come back February 1st with more information from your other municipalities and the minor hockey?
I think that's why this came to council, was so that we could give them the discretion to make the decision. That's why
I know, but some of us are saying they want it in and some are saying they want it out. So who?
Well, I think that's why we just discussed this. I thought that was consensus around the table, was everybody's giving Mr. Robertson discretion to make the decision. And before he does put it out, that he'd let us know.
So if we,
I just want to make sure council is going to be fine with the decision, whatever's made. That's all. I'm just saying council won't have an authority to probably change that decision because we're giving them full authority. Not arguing and disputing they won't make the right decision by any means, Chief, but want to make sure council is comfortable with that. Deputy Mayor Warden.
yeah, that's why. So if we defeat the motion, then it's to come back at the next meeting. But if we pass it, we're leaving it in there and staff's hands. That's my understanding of this.
Yes, no, I agree with you. That's why I was wondering if we shouldn't have just deferred it till we get more information back from minor hockey. So, okay, I'm just saying whatever decision staff makes, I want to make sure council doesn't come back and say it was the wrong decision or at the wrong time.
Realistically, $2,000.
I didn't hear you, Councillor McDonnell.
Realistically, 2 weeks could be $10,000 according to Mr. Robertson's numbers.
But remember, if minor hockey is out there and we do have other people who want to use the ice, they're the ones that are paying the tax dollars to support the ice and using our arena. So we have to be careful on both sides here. That's all I'm saying. If minor hockey doesn't come back and we only have maybe 8 to 10 kids using the ice, I have no issue removing the ice. If minor hockey comes back, and I'm not sure where the junior or the Rebels are still at this point, but if nobody's returning, I have no issue taking it out. I just want to be careful in regards to what the decision is made. Councillor Lang.
Thank you, Mr. Mayor. Well, it does say in the thing that we give them the pending consideration of realistic return to play. So we're giving staff the ability to take this ice out once they've determined that there's not much chance that anybody's going to come back to play. So, anyway, and the other thing is, council can always change its mind. We can
Well, yes,
pass another one after changing our mind if we decide to.
might be too late if the ice is out, though. Councillor Jaworski, did you have a comment?
I mean, as much as I want to make sure there's a situation where there's ice, if the community can use it, I do also want to put trust in Chief Robertson that he's gonna, make that decision. He's heard what we're saying about how, it's important to many of us that that's done. So I trust that he will not make a rash decision and that he'll look at all the options that are possible. So, I mean, as much as I think it's important so much is changing right now. I think it makes sense for them to have that authority. But again, I trust you, Chief Robertson, that you're going to take into consideration what's been said tonight.
Thank you. And I agree 100%. I'm not saying in regards to anything in respect to the chief, in regards to not him or him not making the proper decisions on behalf of council. I know he will do that. I just want to make sure council's comfortable enough that that's what we're doing and that they'll have the final decision in regards to when the ice does come out. So you heard the motion, then all in favor of that motion? The motion's carried. Thank you. Chief, if you can keep us updated in respect to that, would be greatly appreciated.
Most definitely. Thank you very much.
Thank you. Number 7, rural economic development funding application. Ms. Baggs, I believe you're on.
Good evening.
Oh, there you are. Good evening.
Can you see me okay?
Can't see you at all. No, we can hear you.
Okay. Look, oh, here we go. Okay. All right. So this evening, I'd just like to present a report basically explaining some rural economic development funding that's through the province. So most of you might be familiar with this stream of funding. It comes around most every year. And it highlights specifically rural economic development projects and specific projects that enhance the community and the viability and attraction, investment attraction, all that good stuff that goes along with economic development, and in particular with a focus on the rural lifestyle. So this session or this stream is called Strategic Economic Infrastructure Stream. There is 30%, I guess, funding per dollar through this stream, and it's specific to capital projects. So recently, and just back in September, council passed a signage policy. And because council passed that signage policy, it actually gives this application some weight to go further on. So part of the criteria of the actual application is that the municipality has engaged in a study or has done some research about what they're applying for. And so this policy will be attached to the funding application with kind of consensus that council supports this initiative. We have a brand new design and now it's time to implement it. So as far as budget goes, signage was considered within the planning part of the economic development budget. So it wouldn't add anything additional. It would just give us opportunity to maybe put a couple more signs up.
Okay, thank you. Any questions or comments from members of council? Not seeing none. I have a motion moved by Martin Lang, second by Stephanie Jaworski. Be resolved that staff report 07-2021 be received and that the council of the township of South Glengarry supports the funding application for the rural economic development RED program strategic economic infrastructure stream to enhance wayfinding signage throughout key locations in the township as per signage policy 01-2020. You heard the motion. All in favor of the motion? Motion's carried. Thank you. And the next is the South Glengarry Internet Needs Analyst Project. Shauna?
Yes, thank you. So this project is a really interesting project, and it started actually a couple of years ago with the discussion of connecting all of South Glengarry residents to internet and the inability to be able to connect to good internet. Councillor McDonnell spearheaded the connectivity committee, And part of that committee's mandate is to develop a plan on how South Glengarry can get every resident or business connected to a viable internet that's both cost effective and reliable and meets a certain level of speed. So that being said, there are definitely a lot of programs that are available currently right now, both at the at all levels, at the federal level, at the provincial level, and of course at our local level. We hear it on a regular basis what residents would like to see for internet service. And over the last few months, there's been some specific funding, including the ICON grant. There's also been a presentation done at County Council with EORN, who's a big supporter in Eastern Ontario for providing connectivity throughout the township and all of SDG for that matter. At this point in time, taking all of that in and all of this different available money and all of these different internet providers, all of it together, and kind of take a step back and look at it. There's all this stuff available. Everybody's on the same page, but nobody seems to be connecting, or there hasn't been a lot of infrastructure that's actually been constructed up to date. There's little projects here and there. They're kind of scattered, but there's nothing specific. So this particular report is a request to council to have permission to go to a request for proposal to hire a technical consultant that can do a specific analysis of each particular parcel within the municipality of how they can be connected, what their current service is like, and then give us a plan on how to do it. So what is the cost? Is it, millions of dollars, which it probably will be, but we need to know what the actual cost is. And then we can make a plan. So as long as we know what it is, then we can go from there. There's lots of different avenues that other municipalities have taken. There's different options for potentially on taxes. There's different options to partner with independent financiers. There's lots and lots of options. And I'm hoping with this particular report, it would then go to the Connectivity Committee for review and discussion, and then further to that go to council, and we would have a framework or a roadmap that we can then work from and start checking off those boxes and getting as many people connected as quickly as possible.
Okay, thank you, Ms. Baggs. I'm going to open up questions, but I have one for you first. How close of contact are you with in regards to EORN? Because my understanding is they have all this information that we already are looking for.
They do, actually. I was speaking with Lisa Severinson over the last couple of weeks. I've touched base with Tim Simpson from the counties. There is a report, but it's confidential. It's not something that we can make public, but we are, as the township, we're able to see the information. A lot of this information is done on a larger scale. What I'm hoping that the consultant can do was even take that information that through EORN, review it and give us examples of how we can then action it through the township.
Okay.
Does that answer your question?
Yes and no. It's just, I know they're approaching the federal and provincial governments in regards to trying to get funding and working with other private companies to get internet services across the counties, or across Eastern Ontario, I should say.
Yes.
So I'm just wondering if we're duplicating the work that they're trying to do. And I know and realize you're saying, you're going to take their numbers and maybe make it not different numbers, but maybe rip it apart and get more areas in regards to where we need it. But I'm just wondering if we're duplicating our funds, and how much would this money be that we're going to spend to get the answers from this new consultant. Sorry, I got to plug my computer in. It's going to die. That's
okay. I figured that. Well, that's a really good point. I was concerned with that myself because I often think that there's a duplication of effort, and if the information's already out there, then we definitely should be using any information that's available to us. there is information there is a study that has been done, and it has been a review of the entire SDG, but it's not necessarily at the granular level that we needed for it to be able to give us a clear path on what the next steps are in order to make sure everybody is connected to the highest internet possible. So EORN is definitely on the ball. They have done excellent studies and they have lots of information, but they themselves are also looking for funding and partners as well. And they're looking at it for all of Eastern Ontario. So this specific study or this analysis would be specific to South Glengarry. And at the end of the day, the whole point of it is to see how much would it cost for everybody to be connected, how long would it take, and how do we go about doing it? And like with examples, like not, you could have to contact one provider, you could do it this way, you could do it this way, you could do it this way. You could do it in a variety of different ways and you could get the end result.
Okay, thank you. Councillor Martinell.
Through you, Mr. Mayor. Thanks, Shauna, for bringing this report. I think it's very important as far as, I think it's one of the largest complaints we get in the township. It's definitely one that I get often. I spent about 3 years trying to work in a non-office based job, 2.5 megabytes of download, which is not enough to run a Zoom meeting. But I think the bigger part to this is, like you said, we have something from EORN at this point. It's confidential, but it is on a large scale. It's talking about probably Glengarry County as a whole. If we're lucky at that point, we're talking something more granular, because when we speak with the Jason St. Pierre's at Bell or Net Solid Internet or ExploreNet, when these companies come to see us, they ask us, where's your poorest service? And it's kind of like, well, pick a location, but they don't want to just take our word for something. If we have something like this, then we can use that to encourage private businesses such as Net Solid to expand their operations into a certain area where we can say you're going to connect this many homes because they have this much download. You can work off of this tower. This is what it's going to cost you to do it. They don't have to go out and do the cost assessment ahead of time. They just have to check our numbers. And then from that point, we could put ourselves in a better position to actually have people connected, as opposed to waiting for the federal and provincial governments to hand it down to us. Because as we've seen with some of the other provinces in different sectors, like say even the energy sector, sitting waiting for the provincial and federal government hasn't gotten them very far. So I think we're pretty far down compared to even a project like that. So if we're looking at this, putting ourselves at the front of the line as opposed to sitting back waiting for help. At this point, the only way Bell expands their service is basically if they get enough calls and enough persistent people pestering them for better service. And even at that, it doesn't often happen. I think we've only seen really one group that was heavily successful in doing that. And there's lots of groups that have been persistent afterwards and still haven't gotten anything different. So I think this is an important initiative. That's why we decided to start treating connectivity like roads.
Okay, thank you. Any other questions? Councillor Jaworski, please.
Thank you, through you, Mr. Mayor. Thank you, Ms. Baggs, for the report. I mean, like to echo what Councillor McDonnell said, this is really one of the most common complaints for our area. And while I recognize that EORN is doing a lot of work and pushing this file, it really is at that Eastern Ontario level. I mean, for what we've been told, the level of data they have is at a high level, whereas we are looking for the lot by lot, road by road through South Glengarry data, that if we have that, I think we will be very much empowered and be able to move ourselves closer to the front of the line when it comes about expanding, the services and being able to take advantage of the funding that is coming. I mean, these things are coming, they're coming, but the horizon is quite far out. And I think this is, something that will help make that, bring that closer to reality. And I think this is information, like if the EORN data is not public and we can't see it, like we need data that we can actually consult, share with the public, help, in that respect. So I think it's money well spent. I mean, certainly I know I've got 3 kids doing online learning at home right now, and I work from home. It's, yeah, this is something I think, and I'm not alone in that at all, in that kind, in the struggles. So I think this is something, I think this is money that would be well spent.
Okay, thank you. Ms. Beggs?
Through you, Mr. Mayor. I think that the end result of the project itself is the really key part is to create that business case for South Glengarry, because there are different ISPs that have approached the township, or that residents have approached different companies and to get connected, but there's just no business case, and you can't blame them. Like, it's just cost, the amount of dollars that they'd have to put in for infrastructure just far outweighs what they'd be getting on a monthly basis. So if we have a strong report that's as a whole, that can be seen as a whole instead of piecemeal, then that'll actually give, just that itself will give weight to any kind of ISP that comes through, and shows that we have a plan, and that we're serious, and there's people that want it, and here they are.
Okay, thank you. Deputy Mayor Warden?
Through you, Mr. Mayor, is there any, the mayor and I get updated maybe more than the rest of council, and my only concern about this is that this information already exists through the EORN network, and I'm just wondering if there's a way that if we could find out that it isn't going to be duplicated. I don't disagree. This would be great information, but if it already exists through EORN, through our tax levies and the upper tier, we've invested well more than this alone into what the EORN and the regional network is advocating on our behalf. I don't think it's a problem. I just don't want the information duplicated. So is there a way, can we find out for sure? Is there a way we could circle back from to EORN and maybe through the mayor as the warden? I'm okay to support this, but only if it's not duplicating information.
Thank you, Ms. Beggs.
Through you, Mr. Mayor. Thank you, Deputy Mayor. Yes, I totally agree. I don't think there's any point in duplicating information. It takes too long and it's really expensive. The information that EORN has, I have been speaking with them, as well as with the counties to obtain that information. So we will have access to it, and we can review it in-house, kind of thing, to analyze. So I'm not sure exactly what level it will be at. I don't think it'll be as granular as what I'm hoping, but you never know, maybe. I think though, for the consultant and we would need that information from EORN. Like, even if the consultant doesn't have to go out and get that would just save us some money for that portion. But it's the end result. It's the plan after the fact, saying, this is what you have, this is what you have to do to get connected. All those things, all of the different, you can go here, you can go here, you can do this, you can do this. And this is the timeline that it's going to take, and this is how much it's going to cost. That's really, at the end of the day, what I'm hoping the consultant can provide.
Subsequent, Mr. Mayor?
Question, yep.
Yeah, but isn't that what EORN's doing already? Or is that not going to come back to us from them? Or am I misunderstood that?
They do. It's just on such a broad scale. This is be more specific to South Glengarry, so that we have an action plan just for our residents that are here, and we'll have a more clear timeline. Because EORN does have a great project, and they have lots of things on the go, and they know their stuff really, really well. It's just for this particular project, especially when it comes to the connectivity committee, part of their in the terms of reference are that there's actually going to be a plan developed, and the cost that I have put in the report is on the high end. I spoke to many people. It may be able to be done for much less money through both of those two funding programs that have already been received from the township. So it's not coming out of any specific tax dollars, like local tax dollars, but it may, I just wanted to include at the top end, but it may not cost quite that much.
Okay, thank you. Final question, Councillor McEnell.
Just a comment, I guess, maybe to put Deputy Mayor Warden at ease. It's based on what we got from EORN when we did the discussion. The current project they're working on to connect Eastern Ontario started, I believe, at Belleville, and if it's a 4-year plan to get to Kingston, to the outside edges of Kingston, I think is what they're talking, because they're doing north, and on the south end, they're starting at Belleville, moving this way. By the time we get 5G on their time watch, we're looking at like they'll have 6G out. We're going to be well behind by the time the technology gets to us. So if we can find an alternative for the time being that's going to keep us at least at a better, the only way we're going to get any of that money quicker is really to get a result quicker, we have to do it ourselves, because at this point, the circuit's moving the center of the province this way, and we can't get it from Quebec. So we have to wait for it to slowly creep its way across the province to the very far corner. So at this point, we're better to move forward ourselves and get something more granular. And I think that's what we're looking to do, is get something with a little more teeth to it than what the province and what EORN's already done.
Okay, I will get more information in regards to EORN, just to the fact that the last Eastern Warren's caucus meeting is that my understanding from them is that they want to get Eastern Ontario covered roughly all at the same time. So it was my understanding is that they were going to be looking at different providers for different areas and trying to do it as a whole, because each municipality are paying big dollars to do this, and I'm not prepared to pay big dollars if we're 5, 6, 7, 8 years away. I'd rather pull the money out and do it ourselves, because if we can do it faster, I would prefer that, but that's not my understanding from EORN, but I will get clarification in respect to that. So I do have a motion moved by Sam McNell, second by Stephanie Jaworski. Be resolved that the staff report 08-2021 be received, and that the council of the township of South Glengarry directs administration to prepare and issue a request for proposal to retain a qualified consultant to prepare a high-speed internet needs analyst for the entire township. Sorry, all in favor of that motion? Motion's carried. Thank you, Ms. Beggs. Okay, we'll move to number 9, Fredkin Grant Mario Construction Limited zoning bylaw amendment. Mrs. Haley.
Thank you. Have a good night.
Have a good night.
Good evening, everyone. Thank you, Mr. Mayor. So the zoning amendment staff report that's before you this evening is for a property that's located in Glen Walter. All of you would be familiar with the location. It's directly west of the gas station and on the east side of an existing 4-unit development. The proposed development is to combine 3 existing parcels of property that were zoned general commercial and residential. And by combining these 3 parcels of property, it would provide sufficient amount of land to be able to construct a 3-unit townhouse development. At our last meeting in December, on December 21st, 2020, we had a public meeting where this application was presented, as well as an artist rendering of what the proposed development would look like. You may recall that we did not receive any negative comments through this public process. If anything, I definitely have heard some positive comments about seeing additional development occur in this location in Glen Walter. So in the staff report before you this evening, it addresses all the requirements for a planning rationale under the Ontario Planning Act, with a recommendation to approve this zoning amendment that would result in the consolidated lands being zoned residential 3 to accommodate a 3-unit townhouse development that would front on County Road 2 with access off of the Glen Walter Park Road.
Okay, thanks very much. We've been through this before, so pretty self-explanatory. Any comments or questions? Not seeing none. I have a motion moved by Lyle Warden, second by Sam McNell. Be resolved that staff report 09-2021 be received, and bylaw 03-2021 being a bylaw to amend bylaw 38-09 the comprehensive zoning bylaw for the Township of South Glengarry, and for the property legally described as part of Lot 12, registered plan number 101, and part of lots 52, 77, 78, and 79 of registered plan number 142 in the geographic township of Schlumberg, rezone the subject site from general commercial and residential 1 to residential 3 to permit the development of a 3-unit townhouse. You heard the motion. All in favor of the motion? Motion's carried. Thank you. Sailing number 10 is the Leponsi zoning bylaw amendment.
Thank you, Mr. Mayor. So this zoning amendment application is a very common type of application that we receive many times throughout the year, where we have a property owner that has requested to sever their residential portion from the farmland. And as per the Ontario provincial policy statement, we're required to rezone the retained land to prohibit residential construction. And in South Glengarry's case, if it's not large enough to meet our minimum lot area of 20 hectares or 50 acres. So once again, we held a public meeting for this application on December 21st, 2020. We received no negative comments. We are following the requirements of the provincial policy statement. It's conforming to the official plan, and therefore my staff report references all applicable sections with a recommendation to approve the amendment. So thank you.
Thank you. Any questions or comments? Not seeing none. I have a motion moved by Stephanie Jaworski, second by Martin Lang. Be resolved that staff report 10-2021 be received in bylaw 04-2021, being a bylaw to amend bylaw 38-09, the comprehensive zoning bylaw for the Township of South Glengarry, for the property legally described as part of Lot 33, Concession 1, NRR in the geographic Township of Schlumberg, now in the Township of South Glengarry, County of Glengarry, be rezoned from agricultural, AG, and natural hazard to agricultural / exception, excuse me, 26, and natural hazard to reduce the minimum lot area from 20 hectares to 18.69 hectares, and to prohibit residential construction. Be read a first, second, third time passed, signed, and sealed this 18th day of January 2021. And the Council of the Township of South Glengarry confirms that no public comments were received on this application. Therefore, there was no effect on the decision. You heard the motion. All in favor? Motion's carried. Thank you. And number 11 is the Bertoldi zoning bylaw amendment.
Yes, Mr. Mayor, thank you. So this last zoning bylaw amendment staff report that's before you is a little bit different, where we have a parcel of property that's approximately 93 acres in size, located on the south side of Concession 10 in the northeast corner of our municipality. This is a situation where a cabin would have been built several years ago, and probably, unbeknownst to staff at that time, never received any comments or complaints. However, the current owner has recently relocated the cabin to a much more visible location on the parcel of property, where it raised some question by members of the community, and so it needed to be addressed. So you may recall at the public meeting on December 21st, I did show some photos of the existing cabin, the size of it. And so in working with the property owner to better understand the situation, how long it's been there, what recently has occurred, it made us realize that not only did they not conform to the zoning bylaw, they would also need a building permit to rectify the situation. So the purpose of the zoning amendment request and the staff report and recommendation before you this evening is to rezone the subject property with a special exception to permit a cabin to be the only and the primary use of the subject property. The property is primarily treed. I understand in working with the property owner that it's used for hunting purposes. So more so of a weekend getaway to get outdoors. And this will allow them to bring it into compliance and use it within the laws of the bylaw. So if there's any questions, please let me know.
Okay, thank you. Any questions, Deputy Mayor Warden?
Sorry about that. My mouse is on the other side. I just want to thank staff for working with this landowner to rectify a situation. Sometimes we hear that they have to tear buildings down and stuff, so it's good that we're able to come to an amicable solution. Thank you.
Thank you.
Thank you. Any other questions or comments? Not seeing none, I have a motion moved by Sam McDonnell, second by Stephanie Jaworski. Be resolved that staff report 11-2021 be received in bylaw 05-2021, being a bylaw to amend bylaw 3809, the comprehensive zoning bylaw for the township of South Glengarry and for the property legally described as part of lot 17, concession 9 being parts 2 and 5 of the reference plan 14R6139 in the geographic township of Lancaster, now in the township of South Glengarry, county of Glengarry, be rezoned from agricultural AG to agricultural/exemption 27 AG-27 to permit a cabin as a primary and permanent use. Be read a first, second, and third time, passed, signed, and sealed this 18th day of January 2021. And that the council of the township of South Glengarry confirms that no public comments were received on this application. Therefore, there was no effect on the decision. You heard the motion. All in favor? Motion is carried. Thank you, Mrs. Haley. Number 12 is the private road assumption policy. Mr. McDonald.
Thank you, and through you, Mr. Mayor, I hope you can hear me better. I adjusted my mic, so I'm hoping that's working out well. Thank you. This policy is in front of you as a policy and bylaw that I'm tabling for your review. It is only first and second reading this evening, and I wanted to give council sufficient time to review the policy. The intent of the policy is to provide the framework for residents or associations on private roads to bring their roads up to an acceptable municipal standard. How that happens, who's responsible for the cost to do such, and that would then allow the council of the township to review the request to assume the road and then deem it as a public road should they wish to do so. The intent as well is to make sure that there's equity and that there is transparency between development on private roads and typical type of development that occurs through subdivisions, and ensure that we are treating everybody fairly. So this framework is a bylaw that has been put together. I did review bylaws from other similar sized municipalities that had private roads as well, and I've incorporated certain aspects of their bylaws into this bylaw. There's two essential ways a road can be brought up to municipal standards and assumed by the municipalities. One is that the ratepayers themselves take on the work and have the work done, or they can also go through the local improvement process that's outlined in the Municipal Act. So essentially what I'm doing is asking council to review the report, provide me their feedback and comments. There is no sense of urgency because we are currently not reviewing any requests to bring private roads into municipal service standards. So I would like to bring this report back pending your comments for the second meeting in February to have it passed as a policy and bylaw for the assumption of private roads. I'm open to questions this evening, but certainly I would anticipate the council will be providing their comments post the meeting over the next 2 to 3 weeks.
Okay, thank you, Mr. McDonald. Is there any comments or questions this evening, or? Oh, Councillor Lang, sorry.
Thank you, Mr. Mayor, through you, and I'll keep it brief because we are 5 to 10 already. We have a bit to go yet. And something just to think about, I don't want an answer tonight, but just in Appendix A, for the surface material, we're talking about granular A and compacted depth. Something we might want to think in there, we're looking to get all of our roads at some point hard surface. Do we want to make sure that before we take any roads over, they have a hard surface on them? I don't know if that's a consideration, but something to think about. Thanks.
Thank you. That's a good point. Councillor Lang, Councillor McDonnell.
Like Councillor Lang, I'll be brief, and it might be contradictory to what he said, but I would just suggest that if we make the requirements for us to take on a public road too much, with the exception of maybe a new subdivision or a new road, any of those ones along the front of the St. Lawrence where there's not even 66 feet there on each side between the houses, you'll never have to worry about taking them on because you'll never meet the requirements for it. So just something to keep in mind. We'll never take on any new roads if we make it too hard.
Yeah, the only thing I want everybody to keep in mind is the liability of fire and fire trucks and garbage pickup and land ambulance services and so on and so on, that if we take over the roads, we may be liable in respect to making sure that we have access to them. So we just have to watch what we are going to be taking. So any further comments, please relay them to Mr. McDonald over the next couple of weeks so we can have a report come back on the 1st. I do have a motion moved by Sam McDonnell, second by Lyle Warden. Be resolved that staff report 12-2021 be received into the council of the Township of South Glengarry. Read bylaw 07-2021, being a bylaw to establish a policy for the assumption of private roads the first and second time this 18th day of January 2021. For the motion, all in favor? Motion's carried. Thank you. Thank you, Mr. McDonald. Deputy Mayor Warden, if you wanted to bring up your resolution from or motion in regards to supporting the county council one.
So there was two. I made a mistake a while ago requesting. I think I asked for item 6 instead of item 7, but that's okay. I don't have it in front of me, but this morning at County Council we passed a resolution calling on the provincial government to open small businesses immediately, and we're urging them in the wording. I don't have it. I think the mayor has the wording in front of him. Basically, through the presentation from the Dr. Paul from the health unit, larger big box stores are having an advantage over small box or small mom and pop shops, and so we passed the resolution at County's Council, and I'm hoping we'll pass it here tonight as well to forward it to MPP Jim McDonnell, MPP Clark, the Premier, and other municipalities in SDNG, or maybe even the province. So.
Yep. Okay. Thank you.
Sorry. Yeah.
Yeah. No, it's self-explanatory. It was certainly lots of comments around the council table this morning. A lot of upset mayors and deputy mayors in regards to the small businesses that they may be losing their communities because the province won't allow them to open. So this is a request going right across the counties and right across the province for support. Motions to support the United Counties of SDNG in respect of having the province open the small businesses immediately, following the proper guidelines and protocols that are in place from the province. I do have a motion. I have it moved by Lyle. I just need somebody to second the motion. Councillor McDonnell. Thank you. So I have a motion moved by Lyle McDonnell, Lyle Warden, second by Sam McDonnell. Whereas the Council of the Township of South Glengarry has received a motion from the Council of the United Counties requesting that the province of Ontario allow small businesses to immediately reopen with the required health guidelines and protocols in place. And whereas the Council of the Township of South Glengarry shares the concerns of the Council of the United Counties, now therefore it be resolved that the Council of the Township of South Glengarry supports the resolution from the United Counties and directs the clerk to forward a copy to the resolution to the Premier of Ontario, the Minister of Municipal Affairs and Housing, and MPP Jim McDonnell. You heard the motion. All in favor of the motion? Motion's carried. Thank you. Thank you, Deputy Mayor Warden.
Problem.
Okay, and we'll go to the next one, which was number 1 out of the information purposes, review on water bill layouts. And I guess we can probably include number 2 in the same thing, Councillor Dorsky.
Sure.
Did you want to speak to that, or are you just looking Mr. McDonald to speak to that?
No, I have comments. I can give the comments.
Thank you.
Okay. So thank you through you, Mr. Mayor. So with respect to the water bill layout, I don't really think what's being proposed is at the level of what we're looking for. I think even if we're looking at a minimum standard of clarity, I don't think the suggestions are there. I appreciate Mr. McDonald's work, but I don't think they're there. And in discussions with some other councillor colleagues across SDNG, there are others who are using VADM and who also are not satisfied. So I would suggest that perhaps, reaching out to colleagues in SDNG that, maybe there'd be others who would be willing to, work together to, rework this, because my understanding is if we pay VADM a bit more money, there are a lot more options that they could incorporate in the design. So maybe by working together, we can keep that cost fairly reasonable.
Okay, any comments, Mr. McDonald?
Yes, I agree, and have to admit that this water bill renovation, I'll call it, isn't a work of passion for me. But I certainly see there to be some benefit to contact the other municipalities, in particular, with Councillor Jaworski's mentioned that they're not pleased with it. Perhaps we can share the cost out. This was going through what they could do, so we did have a VADM expert come through and kind of click and change and show us a few options. But a bill redesign would cost a little bit more, and I think would be prudent to connect with the other municipalities, because we all sell water, and if we're all unhappy with our bill, why have one pay where 6 can pay and we can get what we want? So I think that's an excellent, and I'll take that step to contact our neighboring municipalities.
Thank you, Deputy Mayor Warden.
Through you, Mr. Mayor. Yeah, I'm a little disappointed myself. I mean, we asked for a bill to be redesigned, and all that we got was a graph. I mean, our bill, like I just checked out my last bill from December. It still has the old township logo on it. We haven't had that logo in how many years? So, anyways, I think we can do better, and hopefully, I mean, it's been on the go since August of 2019. I get it. Last year was kind of a wash with COVID, but it is disappointing. So hopefully we can come to something.
Okay, thank you. So, Mr. McDonald, we'll leave it in your hands to come up with a different design or some other.
Yes, I will contact the other municipalities because, as I said, I haven't heard it save for the 2 councillors, but I do agree the bill can be improved. This was our kind of like our light swing attempt to see if we can do it with a little bit of money. Deputy Mayor Warden has previously mentioned that he doesn't mind putting a little bit or enough more money to make it clear. I can't guarantee what their system can do, but we'll put it to their development team, which is hopefully get rid of some of that excess. Like there's a lot of things in there. I asked if we could click them off that don't provide any clarity. They mean nothing to our water user. They only mean something on the system side. It's not beneficial. So I will carry on those conversations, and I appreciate the disappointment in the bill, because it's not exceptional. It's not there yet. I can't guarantee we'll get perfectly there, but the next step should make it a significant improvement. Those would be my hopes.
Okay, thank you. Anything else, Councillor Jaworski, on that item?
No, not on that item.
Okay, thank you. Deputy Mayor Warden.
Through you, Mr. Mayor. I mean, I don't know, is VADM the be all end all to municipal water bills? Like, we're updating our software for our township agendas coming through. Maybe a look outside the box. I don't know, but it's so complicated to read a water bill. And I mean, it probably doesn't even meet the standards for accessibility for someone with an impaired vision to read the darn bill. Like, it's time we update it and make it so that it's legible, because I'm sure anybody who has a slight vision impairment would have no way of reading this bill.
Yeah, no, your points are valid. I'll come back. As I said, this isn't a particular note of passion, and it has taken a good amount of time for me to come back, and the answer is not at the level we require, and next one will be better. I almost think it'd be easier to do a data dump into Excel and then just make a mail merge, but I imagine our accounts receivable clerks would probably be shaking their heads at me, Vadim, that particular question. It is our full finance software. I don't think from talking to others, I've ever heard of somebody using like another program to do any of the billing. That doesn't mean it's not out there. I can look for that too. I mean, I want this to be easy and simple because I would like it off my unfinished business list just as much as you want it to be done too.
Okay, thank you. We'll look for something coming back from you in the near future. And I repeat, near future.
So do you want me to continue with the water survey results?
Yeah, go ahead. Sure.
Great, thank you. Through you, Mr. Mayor. So thank you very much, Mr. McDonald, for compiling those. And there was just the one thing that stood out to me was about, the suggestion about considering development charges. And so I just wanted to raise that, and that, the fact that was raised, there's a lot of, I think it merits a discussion, or, looking at it a bit more depth, because certainly in Glen Walter, we need to upgrade those systems to be able to accommodate all the folks that want to connect. So, I think there could be, I think it makes sense to consider, perhaps we should be looking at having development charges to try, to help fund the, expansions of that system in particular. So I don't know why we have no charges as it is today, but I would like more information on that.
McDonald, any comments? And I'll go to Deputy Mayor Warden after.
Yes, we had them in former Schlottenberg Township. The person in our organization who knows the most about development charges, I believe she's probably prepared multiple presentations to different councils over the past 23 years now, would be Mrs. Haley. So if you want to add something as to the perspective as to why or why not, or we can come back with a staff report with a little bit more. I don't need to belabor this meeting further, but she would know more. And other municipalities, the North Dundas Treasurer would kind of tongue-in-cheek call it the manna from the gods, because it is growth pays for growth, and the reserves can get significant.
Okay, Deputy Mayor Warden.
Is this something that could be added to that meeting in regards to make it a more round meeting, not just efficiencies, but I think there's some merit to that. And we're struggling with our reserves. We had to do that large water increase a couple of years ago. So I think this is maybe a discussion we could have at that kind of meeting that we talked about earlier in the evening. Could we not do some sort of a planning and efficiency and forward thinking for the future? I don't know.
Yeah, Mr. McDonald.
Yes, I'm sure we can. I'd have to give a lot of that research to Mrs. Haley to start with, just because she knows quite a bit about it compared to me, but I will get up to speed with that. And I suppose the meeting that you're talking about would come probably through the CEO, and I'll prepare whatever I need for that meeting. If it is about our procurement policy was noted earlier, and then perhaps a review or a little reminder of what development charges or community benefit charges we could charge, and then council can make some decisions from that. So yeah, we can prepare the information.
Okay, thank you. So what we'll do, Deputy Mayor Warden and Councillor Dworsky will ask to have that added to a joint meeting with the other one sometime in the next week or so, week and a half, or a couple of weeks, I guess it would be. Okay, anything further on there, Mrs. Councillor Dworsky?
No, I'm ready to go to the next one.
Okay, before we go to your next one, we're going to go to Lyle's next one. So Lyle, is it number 6 or number 7 that you wanted to talk about?
I was number 7. Wanted to support the county. It was a resolution we passed at county council. I'm having a hard time finding the page where we're at. I think I'm very close here. But the one above it was it's basically the same thing. It was basically asking to be able to spend some of the COVID money on capital. So yeah, I would like us to consider supporting the resolution from the December 21st meeting of Asneji County meeting. It's pretty self-explanatory, so it'll come back at the next meeting, correct?
So that was your request to bring that one back at the next meeting. So Madam Clerk.
And I'm also fine with bringing item number 6 back at the next meeting as well. Thank you.
Letter of support for small businesses, Town of Kingsville. So you
Yes.
wanted that one also?
Yes, please.
Number 6 and number 7 to return at the next meeting. Thank you.
Thank you.
You're very welcome. We'll move to number 12, Recreation Department monthly updates, November, December. Councilor Jaworski.
Thank you through Mr. Mayor. Just very briefly, I just wanted to pass on to Chief Robertson that I had a lot of positive comments about the seasonal lights, how there was more that were put up in the villages, and in this time that's a bit dark, let's say, with the pandemic, a lot of people really appreciated that. So I just wanted to pass that on. Thanks for that.
Okay, thank you. And bylaw department year-end report.
Thank you. Yeah, that was me too. So through you, Mr. Mayor, when I was reading through that, so thank you very much to Ms. Brunet for putting that together. One thing that caught my eye was with regards to the orders, is that very many of the orders are generated by just a handful of owners. And I just wanted to put the question out there, if there's something, like, first of all, I'd be curious as to know like what financial burden that represents, because I think it's important to understand what it costs us to do enforcement, repeat enforcement, but also if there's something we should be looking at in our process to streamline those kind of issues, if there's anything we can do to either lessen the burden or make it more efficient.
Thank you, Ms. Brunet.
Mr. Mayor, thank you, Councillor Jaworski. Good evening, everyone. We're going to make this quick. While looking at the orders, I would say confidently that there is no financial burden. The reason for that being, when an order is issued, there's a fee that's attached to it of $50. Following that, when the township has to do the work, it never gets charged to the township. It's actually brought back to that property. They have to pay the work that's done with an administration fee. And if it doesn't get collected by them willingly paying, then it gets put on to their property taxes.
Okay, great. Thank you very much.
Not a problem.
Okay, thank you. And we'll move to number 15, 2020 building permit activity summary. This is Councilor Jaworski.
Thank you, through you, Mr. Mayor. I just want to highlight that the construction value of the permits in 2020 has gone up over $2 million versus 2019. I know there has been increases to construction costs, but still, I think it's remarkable that this has occurred through the pandemic. And I just wanted to also thank staff who obviously have supported those efforts through that, and were able to be very efficient again through slightly more difficult work processes. So thank you to them.
Thank you very much. I'll pass that on to the staff.
Appreciate it. Thank you. And the last one would be the 2020 land use planning activity in comparison.
Mr. Mayor,
sorry, go ahead.
I'd like to add a comment too. I just wanted to say that the pandemic really didn't affect South Glengarry that much in this regard, and it's kind of surprising. And I mean, the real estate market too is it's extremely. I think we're seeing a lot of people coming in from other areas. 2 houses that I sold last week were both from out of town folks. So South Glengarry, I think, is definitely benefiting from that. And I did want to also thank staff for continued support through this past year. I'm sure it wasn't easy. So thank you.
Thank you.
Thank you, Councillor McDonnell.
Move on. Thank you.
Okay, thank you. I believe that was the last one.
Oh, I have one more. Well, I didn't get to comment on the last one.
Which one was the last one? The planning
the
one?
land use
Oh, yes.
planning.
My
Yeah,
apologies. I did say it, then we jumped back into the other one. Go ahead, the land use planning activity.
I'll continue to be quick. Thank you, Mr. Mayor.
All right.
Again, I just wanted to point out that the activity in land use planning, it's incredible, the numbers of files that have been processed, like 109 versus 66 the previous year. It was 2020 was a record year like 20%. So yeah, so again, thank you to staff for doing that. I mean, again, that demonstrates a lot of activity in the township, and also that reflects a lot of work effort by staff. So again, thank you for that.
Thank you.
Okay, thank you. I have a motion moved by Martin Lang, second by Stephanie Jaworski. Be resolved that the council of the Township of South Glengarry accepts the items presented on the agenda as committee reports and for information purposes only. You heard the motion. All in favor? Motion's carried. Thank you. And we'll move to unfinished business. We'll start with Mr. McDonald, docks on township property.
We've completed the transactions for all but 2 of the properties, the 2 outstanding properties. I'm not too sure if we're going to get much further with them, but we'll have to look at our options, and I'll have something hopefully in February with some ideas on those options for council to consider.
Okay, I think the conversation in the past, my understanding is that if it doesn't go to them, that it stays in the municipal hands until.
That's correct.
Those properties change ownerships, but bring back a report and we'll discuss it at that point. And the fire protection ponds?
Yeah, I've been in touch with the 2 property owners on the Middle Street pond, and we will be working with, I will be working with Chief Robertson to develop a draft agreement for discussion with those property owners over the next coming weeks.
Okay, thank you. And the municipal servicing from the city of Cornwall?
Yeah, there's a letter been drafted and approved by the steering committee to go to the residents on Boundary Road to give them a range of the cost for providing the service from the city of Cornwall, and we'll be able to gauge the interest of the project pending the responses from those letters.
Have the letters went out yet, Mr. McDonald?
We were hoping to have them out towards the tail end of last week, but some of the COVID issues kind of derailed those activities. So the letters will likely be going out in the next day or 2 at the latest.
Okay, my understanding is when we had that joint meeting or the meeting with our engineers that we requested that those numbers would go out to each member of council so that they did get a call, they would be updated in respect to that. So if we could just make sure that, I would appreciate it.
Yes, I was planning to do that, Mr. Mayor.
Okay, just Councillor Lang reminded me to ask the question, so here it is. Okay, private roads development, I guess we just spoke about that, so we'll wait for a report to come back later. And LED streetlights for Glen Walter.
Just waiting for a confirmation of a meeting date with the Cornwall Electric Group to bring forward the proposal.
Okay, thank you. Thanks for your time. And then corporate services, the review of water rates and water bill design. I understand from Mr. McDonald, you have a full report and a new design by February 1st.
Of course, yes, yeah, that's fully contingent on me and no outside sources, but it will come back. We will we'll go the big route, and then I'll come back with a staff report further to the review of the survey.
Yeah, perfect. Thank you. Thanks very much, everyone. I do have a motion moved by Sam McDonnell, second by Lyle Warden. Be resolved that bylaw number 06/2021 to adopt, confirm, and ratify matters dealt with by resolution. By resolution be read a first, second, third time, passed, signed, and sealed in open council. You heard the motion. All in favor? Motion's carried. And if there's nothing else, I have a motion moved by Stephanie Jaworski, second by Martin Lang. Be resolved that the council of the Township of South Glengarry adjourn to the call of the chair at 10:22 p.m. All in favor of the motion? Motion's carried. Thanks very much, everyone. Enjoy the rest of your evening. Enjoy